All right, we are back. Next item on the agenda is item number, there's a couple of items and they're all, so what we're going to do is I'm going to go ahead and take item 12, 13, and 14 and FL1 concurrently since they all relate to ARPA funding. So we're going to go ahead and take public comment. Because we're putting all these items together, I'm going to go ahead and ask and give people 4 minutes to speak on the item, because we're putting them together. And most of the speakers were asking to speak on item number 14. So that gives them a little bit of expanded time. With that, I'm going to go ahead and first turn it over to county team for the presentation. I'm sorry, Michael. And then after the presentation, we'll go ahead and do public comment. Okay.
Thank you, Chairwoman. Let me go ahead and tee this up for the members, and then I'll turn it over to the team, as you just said. In 2021, the county received over $650 million of American Rescue Plan Act, or ARPA funding, from the federal government to mitigate the effects of the COVID-19 emergency. So much was unprecedented in this worldwide pandemic, including this sum of ARPA. And the county sought and continues to seek to steward it well. Back in 2021, the county received community input and the board set up a framework for how to spend the funds, and the last full update to your board in late 2022 revised that framework and created the Evergreen concept to be formulated by the fiscal subcommittee. But several events that we could not have anticipated at that time have transpired since your board's 2022 direction to us. So before the team shares the update, I'd like to set the stage a bit by first addressing why we are here today. As many of you know, we were planning to return to the board next month. In addition to the unforeseen changes on the board, there have been and continues to be emerging needs that warrant the immediate attention to your board, including items on today's agenda that will influence the direction and next steps staff will take in formulating recommendations related to the Evergreen Fund. Acting on this item does not preclude the board from acting on any remaining agenda items. The recommendations were intentionally structured to allow space and to enable the board to provide direction. If I could be frank, staff needs to have the full board's direction on how to plan for any remaining balances of the Evergreen Fund, however it so chooses to use it. We'd like that broad policy and timing direction to be given today. So with that as context, there's a total ARPA remaining balance of $134 million. $67 million of this is in the ARPA framework and available to spend primarily on existing framework components. The other half is in the Evergreen Fund and available for allocation. The team will talk at a high level about where we've invested the ARPA funds, impacts on the region, identify remaining balances and timelines for use, and recognize the work of the fiscal subcommittee. Today's presentation will end by providing you with potential broad areas which we believe are consistent with the intent and priorities of the board. In this way, the goal is to set the board up to deliberate and decide on the ideal timing and approach to planning for any direction to staff on planning for the remaining ARPA balance. With that said, I'd like to now turn the presentation over to our esteemed presenters, Dr. Eric McDonald, Amy Thompson, and Ebony Shelton. Eric, take it away.
Thank you, Michael, and good afternoon, Chairwoman Vargas and members of the board. With the initial framework and subsequent revision, the county has successfully leveraged ARPA funds not only to address the needs of the region to test, trace, and treat COVID-19 cases, but also address the economic and social impacts of the pandemic. With a deadline to obligate the funds approaching at the end of the year and the reality of constrained revenues from the state, we are faced with an opportunity to decide how to use the anticipated remaining balance of ARPA funds, half of which is dedicated yet unprogrammed in the Evergreen Fund. Today I'm joined by Amy Thompson, Executive Finance Director for HHSA, and Ebony Shelton, Deputy Chief Administrative Officer and Chief Financial Officer for the county, to share the impact of the county's ARPA framework investments so far, the status and remaining balance for current components of the ARPA framework, and a report on the Evergreen Fund recommendations made by the board's prior fiscal subcommittee. Following your feedback and discussion on these updates today, county staff will return to the board at a later date with specific recommendations to revise the framework. As you may recall, Congress passed the American Rescue Plan Act in 2021, making a once-in-a-generation investment into local communities. The ARPA funds allocated to our county represent a significant one-time infusion of resources into our region. As you can see on the slide, the types of uses that were deemed eligible by the federal government. The board established our local ARPA framework in 2021, which led the county to take a leadership role in utilizing these funds through a well-thought-out, three-pronged approach that spans all county groups. The first prong and largest investment is saving lives and protecting families. At the outset of the pandemic, our top priority was saving lives, safeguarding lives and families. This meant directing funds towards critical initiatives like testing, treatment, and vaccination sites. A priority was delivering services with an eye to equity and accessibility, focusing on underserved communities as well as communities identified as less healthy in the California Healthy Places Index. As one example of impact in this category, ARPA funds helped support the deployment of over 250 community health workers during the pandemic. This allowed the county to better connect communities impacted by long-standing health disparities to needed services and systems of care. Today, aspects of testing, tracing, and vaccinations are integrated into our ongoing operations, with some required tracing activities still funded by ARPA. We estimate a balance of $25.4 million to be remaining in this area by the end of the next fiscal year, which was the board's targeted timeframe to spend ARPA funds. The second prong is stimulating the economy and getting back to work. As we came out of the pandemic, we took action to help individuals, businesses, and nonprofits get back on their feet with direct stimulus payments. More than 3,800 small businesses and nonprofit organizations were assisted with operating costs, including protective equipment. In addition, ARPA fee waiver programs benefited over 8,700 restaurants and 2,700 special events. We were also able to establish stimulus payment programs for families as pilots to be evaluated and help the county make future decisions about similar investments. A remaining balance of $6.1 million is estimated in this area at the end of the next fiscal year. And lastly, our third prong is investing in our future. Recognizing the importance of long-term safety and health, we allocated resources to support a range of critical programs and infrastructure improvements. For example, one program provided thousands of screenings for middle school students to determine social emotional needs and provide early intervention support. Food assistance was one of the highest priorities identified in the county-led community workshops for the ARPA framework. Hundreds of thousands of nutritious meals for older adults have been provided through ARPA funds, as well as support to food banks and support for innovative nutrition incentive programs. We are also using ARPA funds to invest in the framework for ending homelessness, including standing up emergency shelter sites and funding the development of 74 extremely low-income permanent supportive housing units across the county. And work continues on overall infrastructure improvements funded by ARPA in the areas of broadband, stormwater, sewer, and drinking water. A remaining balance of $35.5 million is estimated overall in this area. This three-pronged structured approach underscores the county's commitment to addressing immediate needs while strategically planning for a resilient and prosperous future. I will now turn the presentation over to Amy Thompson, who will discuss some key milestones in the framework and considerations for the remaining balances.
Thank you, Dr. McDonald. This slide displays the path that led us to the investments just highlighted, starting with robust community engagement to help prioritize the funds, adoption of the initial ARPA framework by the board in June of 2021, and the most recent significant update to the framework in August of 2022, which established the Evergreen Fund. Then on the right, we have some other key dates on the horizon. At the end of this calendar year is the federal deadline to obligate all funds. The next date of June 2025, shown in blue, is the county target date to spend ARPA funds per deliberations at the August 2022 board hearing. However, as seen on the last milestone on the slide, the Treasury allows jurisdictions to expend funds through December 31st, 2026. This is a key consideration when evaluating balances remaining at the end of fiscal year 24-25, which we will look at on the next slide. Okay, and on this slide, we see the projected balances remaining at the end of FY 24-25. The first section, representing components highlighted at the beginning of the presentation, sums to $67 million. These balances are projected using current information, though they could be impacted by various factors such as state requirements around trace activities, timing of new programs being ramped up, and the number of viable emergency sheltering sites. At the bottom of the table is the remaining unprogrammed amount of the Evergreen Fund of $66.6 million, which gets us to the total balance of $133.6 million. On the next slide, we will go through some considerations staff are evaluating when determining programming of the first $67 million supporting ARPA framework programs outside of the Evergreen Fund. In December's economic update to the board, the county's financial outlook was discussed, with an emphasis on the pressures the Health and Human Services Agency is facing around slowing revenue streams and increasing costs for mandated safety net programs and rising caseloads. Staff reported a significant budgetary gap reflected beginning in fiscal year 24-25 and growing into fiscal year 25-26, much of this reflected in the agency. The remaining balance of $67 million in ARPA funds provides an opportunity to prioritize areas to mitigate this gap in the near term for programs that have already been approved as a part of or aligned with the ARPA framework, allowing time for economic recovery and to identify a permanent funding source. The Regional Homeless Assistance Program, listed on the top of this slide, is one such area contributing to the projected budget shortfall in the numbers presented in December. This program supports individuals in the unincorporated area experiencing homelessness and does not have a sustainable funding source. Applying some of the ARPA balance in this area would address an imminent need for funds beginning next year to continue the program without requiring immediate cuts to other programs. We also propose funds to continue any required trace activities in place for COVID-19 and other related costs in 25-26. $4.3 million would allow us to use the remainder of funds allocated for the innovation and foster care pilot, as well as provide some bridge funding for the shallow rent subsidy for seniors pilot. And then on the last row before the subtotal is $20 million to support ongoing costs for programs initiated under ARPA, including homeless and behavioral health services. While we are continually pursuing funding strategies for programs intended to be ongoing, using some of the ARPA balance would allow us to continue these programs into fiscal year 25-26, still within the Treasury's expenditure timeframes, and allow more time to develop a sustainable funding plan, again, without requiring immediate reductions in other programs to do so. And lastly on this slide, we have a FEMA contingency line to help mitigate impacts of any disallowances, as one of our largest programs, the non-congregate sheltering program, is still outstanding. Together, these items would get to the $67 million projected remaining balance and go a long way to mitigating some significant budgetary pressures on the horizon, allowing time for economic recovery, which will allow for longer-term solutions. Now I'll turn things over to Ebony to discuss the balance under the Evergreen Fund and review some of the actions to date in that area.
Thank you, Amy. The Evergreen Fund concept was initially brought up when the ARPA framework was updated in August of 2022, and the board directed staff to explore the feasibility of establishing a fund to draw down matching funds, philanthropic donations, grants, or other funding sources that could provide a self-sustaining revenue stream and public benefit. This direction was further refined during the board's Let's Talk Housing workshop in December of that same year, 2022, with the direction to develop concepts for the Evergreen Fund. The board directed staff to work with the fiscal subcommittee, which is a committee that was established to realign fiscal policies that govern county resources and contracting. Before sunsetting, the fiscal subcommittee recommended 6 conceptual programs for the Evergreen Fund. These recommended programs included proposals to provide support for the behavioral health workforce, housing needs, and to ensure environmental sustainability. At the end of 2023, in response to emergent needs, the board directed specific uses of the Evergreen Fund under the lost revenue strategy, including providing supportive services to asylum-seeking migrants and expanding recovery residents' access for people experiencing homelessness. Together, these specific uses totaled $14 million, leaving $66.6 million of funding available for the Evergreen Fund. Of note, the Evergreen Fund leverages the lost revenue provision of ARPA, where ARPA funds may be used to replace local revenues that were impacted by COVID-19. The use of the lost revenue strategy provides funding and timing flexibility beyond the federal ARPA guidelines, which is critical flexibility for Evergreen investments, especially considering the deadline to obligate funds, which is coming up here at the end of 2024. It's important to also be aware that the capacity for replacing lost revenue with the ARPA framework revenue has been fully utilized. To date, several broad themes have been identified around the Evergreen Fund. When the ARPA framework was updated in August of 2022, the board identified the importance of supporting the behavioral health workforce, providing behavioral health and housing programs. And the fiscal subcommittee discussed these priorities and put forward programs to support these priorities that also had components that support sustainability and environmental justice. The recommendations of the fiscal subcommittee were reported back to the full board in a memo in April of 2023, but the formal return back to the board in open session was delayed with the resignation and resulting vacancy of the District 4 supervisory seat. And since that time, there have been emergent needs in our region, including services for asylum-seeking migrants, substance use disorders, and SB 43, which expands the criteria for eligibility for conservatorship. As well, there are other items on today's agenda which propose additional uses of the Evergreen Fund in response to the needs of the region. Today, staff is asking the board to provide direction to the CAO to return with recommendations for the ARPA framework, including any amounts that remain for the Evergreen Fund, and to receive the staff's update on the ARPA framework. Today's recommendations were intended to be general in nature, to make space for the board's direction on how and when to set any desired parameters to return with recommendations that will ensure the ARPA framework funds are used in total and used in a way that continues the lasting impact that the ARPA framework has had on our region. Our update today has noted an estimated $133.6 million within the ARPA framework that's anticipated to be available for further programming. $67 million attributable to the ARPA framework programs that were established by the board, and $66.6 million attributable to what remains of the amount available for the Evergreen Fund. Because of the lost revenue strategy, once allocated, that $66.6 million attributable to the Evergreen Fund has flexibility as it relates to the timing and the uses of these funds, and staff is seeking direction from the board on the best uses of this amount to benefit the region. The remaining $67 million must be obligated by the end of this year and expended by the end of 2026. Staff have introduced considerations for this amount to extend funding available for programs primarily in the ARPA framework or that are directly related to components of the ARPA framework. Staff is not asking your board to take action on this scenario today, but does intend to provide recommendations based on this scenario during the formal return back to the board in order to mitigate the significant budgetary pressures on the horizon and to avoid cuts to other programs. This approach is a critical assumption that's being leveraged in budget planning activities underway now for the upcoming budget cycle. This completes staff's prepared comments for this item, and we welcome any further discussion, direction, or questions.
Over to public comment.
Thank you, Chairwoman Vargas. As a reminder, again, items 12, 13, 14, and Flood Control District Item 1 are being heard concurrently. So if you requested to speak on one or more of these items, I've combined your speaker slips and we'll call you once. With that, Chairwoman Vargas, we have 46 requests to speak on these 4 items, 28 in person, 18 requesting to speak by phone. Also note, on all these items, we've received 152 e-comments, 133 in favor, 12 in opposition, and 5 neutral. If you've requested to speak by phone on items 12, 13, 14, and Flood Control District Item 1, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of this item. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'll be calling you in groups of 5, so I'll ask you to please listen for your name. I'd like to invite forward Mark Kalimamahu, Jason Richie, Jesus Gonzalez, Seline Gonzalez, and Sarah Johnson. You may come forward in any order. And as the chairwoman indicated, we'll be allowing speakers to speak for up to 4 minutes. If I've called your name, please come forward. Mark, I did not call your name yet.
Oh, you did not?
I did.
I thought you said Mark.
I called a different Mark. Mark
Okay, thank you.
Kalimamahu. I'll ask you to please state your name for the audio record.
My name is Mark Kalimamahu, and I'm part of the HEAL Network, the Homeless Experience Advocacy and Leadership Group from the San Diego Housing Federation. Madam Chair, members of the board, I'm so blessed to be able to stand here before you, being a homeless individual who has been blessed enough to be able to get back up on my feet again and become the man that not only I can be proud of, but being a newlywed and where this journey began is now just continuing to move forward at 65 years old with my bride that was made possible through us meeting at church. I'm here today to speak on item 14 because of how much it means and how important it is to everyone in this particular process. I'm a Marine veteran that was blessed enough to be able to get off the street by way of a housing project that came together that was honored by the city and county of San Diego and the state. And I live in a veterans housing facility that was built for homeless veterans. I continue to live there today with the hopes of moving on and securing my own home as a married husband. This initiative and this program that is available to us now is so vitally important because of the intensifying growth of seniors that are actually homeless. So I'm testifying to support item 14 and investing $8 million in county funds to expand Recuperative Care capacity. Our communities are facing a crisis of care where unhoused people with medical vulnerabilities are falling through the cracks, being discharged onto the streets and left to fend for themselves. Many people who need help with activities of daily living cannot gain access to shelter beds. We need to invest the funds to create safe places for unhoused people being discharged from hospitals to make sure that they get medical help and get on with their recovery journey. Recuperative care is one solution. These facilities provide medical staffing and support. It also frees up space in the hospitals. Please support item 14 and invest $8 million to build more recuperative care beds and provide places for the homeless individuals to recovery. Thank you for your time.
Thank you. Next speaker, please.
Good morning, members of the San Diego Board of Supervisors. My name is Jason Richie. I'm here with the HEAL Network, and I'm here today as someone who has experienced homelessness. I'm speaking in support of item 14 to allocate $8 million to expand recuperative care bed capacity for the homeless. While I've not personally experienced going directly from the hospital to the streets, I have seen friends who have I've seen how the lack of adequate support and resources can push individuals into further crisis, including mental disabilities, addiction, and economic disparity, especially when recovering from a medical condition while homeless. I had a friend, Chris, he was a talented artist, and I saw him go into the hospital and come back out, and he was forced out early because he was taking too long to recover, and they needed the space, and he didn't have a good place to go. And he went to the street, and he deteriorated quickly, and I've lost contact with him, and I fear the worst for him, knowing what homelessness can do, and also knowing that he needed mental care, and he had addiction problems as well. So it's one of the many sad stories I've witnessed. I believe that investing in expanding recuperative care capacity is crucial for our community. It provides a necessary bridge for homelessness individuals who are recovering from medical conditions, offering them a safe and supportive environment where they can receive the care and attention they need. Every person deserves the opportunity to recover and rebuild their life with dignity. It is not just about providing a bed, it is about providing a lifeline and a chance for individuals to stabilize and work towards a brighter future. Supporting this proposal means acknowledging the humanity and worth of every individual, regardless of their housing status. It means taking a step towards addressing the complex challenges of homelessness and offering real solutions that can make a meaningful difference in the lives of our community. I urge you, our Board of Supervisors, to support this proposal and to recognize the significance to ensure that those who are medically vulnerable and homeless have access to the care and support they need during critical times of recovery. Thank you.
Thank you. Next speaker, please.
Good afternoon, Board of Supervisors. My name is Sarah Johnson, and I've been a licensed vocational nurse at Edgemore Hospital in Santee for 20 years. I came here, I am also a proud SEIU member. I would like to talk to you about the behavioral health workforce. As reported, 18,000 skilled workers need to be hired and in turn need to be retained. Working in the behavioral health field is not easy, and it's not for everyone. It can be dangerous and cause burnout with even the most trained staff. Being short-staffed causes stress. Some nurses will be taking care of 32 patients by themselves. This is a dangerous practice for our residents and our nurses. Asking for a day off 20 days in advance and being denied causes frustration and more staff to call in. Staff can also experience compassion fatigue, which is common with healthcare workers. Compassion fatigue is often thought of the cost of caring. It directly affects the healthcare worker and in turn the patients. I read an article describing compassion fatigue. Here's the quote. I find myself snapping at people more often because I'm overwhelmed, partially because I don't know what to do and I feel hopeless. We are asking you to approve this item and invest in mental health and addiction treatment. As a county, we need to recruit and retain experienced healthcare workers. Thank you.
Thank you. As the next speaker is coming forward, I'd like to invite 5 additional speakers. Iristrell, Zanyea Avery, Kim Barrows, Joshua Bohanan, and Ruth Bruland. If I've called your name, please come forward.
Good afternoon, Board of Supervisors. I'm Seline Gonzalez, a dedicated CNA at Edgemore with 3 years of service to the County of San Diego, and a proud union member. Today marks my second time expressing my concerns before you. I'm deeply troubled by the persistent issues of staffing levels and staff retention within our county. The frequent hiring and subsequent departures of employees within mere 3 months create challenges in training and contribute to low morale and frustrations among our team. Despite the obstacles, my colleagues and I remain committed to provide the highest standards of care to our patients. That's why I'm here today to urge you to vote yes on this item, as it holds the potential to address and improve the crucial staffing challenges we faced. Thank you.
Thank you. Next speaker, please.
Hello, okay. Hello, my name is Seline Gonzalez, a proud mental health worker at San Diego County Psychiatric Hospital and proud union member. I have been with the county for over 11 years, and the first 6 years being the primary MHA at the emergency psychiatric unit, the last 5 years working the crisis recovery unit. I worked through COVID. I am an essential employee, working with, around, among COVID patients continuously. I am also a diabetic. I'm here to speak about the rise in healthcare costs. In a time where cost of living in San Diego is the highest, rent impossible, groceries, gas, and inflation, our county leaders should be concerned about the healthcare increase. We are your frontline staff, and in a time where retention has been a struggle, having our benefits dwindle away as we sink deeper into poverty due to inflation and increased healthcare costs is not the right direction. I have been offered jobs from the registry staff I was assigned to train. I have witnessed our own mental health workers quit and move to other states where they get paid more and the cost of living is less. It is crucially important to ensure we attract quality workforce. I ask myself how much money has been spent on registry staff to fill the void of our unfilled empty seats. We need to stop the hemorrhage, this vicious cycle of people getting hired and the mass exodus of when they leave. A rise in healthcare is effectively a cut in pay. We need to address the needs of our workforce. It wasn't until the last equity study done by our union, Local 221, that I became aware of how underpaid we were. And these were pre-COVID numbers, before inflation, gas prices, rent increases, and now health insurance increases. There is still work to be done. We have been named the most expensive place to live in the nation. Our pay should reflect that. This raise in healthcare is essentially a cut in pay in a city where rent is the highest. I am thankful for this opportunity to address my concerns to this board and hope to see the changes necessary that will correct this imbalance. I urge you to vote yes on the flex increase for healthcare costs.
Thank you. Next speaker, please.
Good morning. My name is Iristrell, and I am a proud 17-year SEIU union member and a proud county employee as well. I am here to speak to you about the healthcare cost. Jesse really drilled it down, but I'm just going to give my few little comments as well. Our pay and flex credit is not keeping pace with the current healthcare costs. When I first started at the county, we would receive those emails infrequently about employees requesting to having us give up for us to give up the leave time because they have exhausted theirs. And now we receive those several times a week. This goes to my next point, that our workforce is getting stressed out to the point where their health is being affected. Most employees and family members have pre-existing conditions and need periodic attention and prescriptions. The recent rate hike in healthcare will cause your employees to further make crucial decisions on whether to pay their living expenses or pay for vital health care for themselves and or their family members. This is also a deterrent for potential candidates for employment to apply when they see how much their health care will cost. We are requesting that you fill the gap between the rate hike and our flex credit. The time is now. And I'm going to quote Matthew 25:40. I know you guys know I say this all the time, but when you do, Jesus said, when you do for the least of my people, you do for me. Thank you.
Next speaker, please.
Good afternoon, fellow board members. My name is Zanya Avery. I'm a CNA and a unit assistant at Edgemore Hospital. I've worked for the county for 11 years. Living in San Diego, one of the nation's most expensive places, our pay hasn't kept up. In the challenging world of behavioral health and nursing, where staff shortages were prevalent even before the pandemic, hopes were high after SB 525 passed. However, the uncertainty of the $25 minimum wage implementation adds to our concerns. Our plea is for you to support in the form of retention bonuses, premiums, education, pay increases, and recruitment. These are not just policies, they directly impact our lives. Personally, it's been tough to visit my son in college while caring for my elderly grandmother. I stand here not just for myself, but for all of us. We are calling on you to approve this crucial measure. Let's invest in our county employees and ensure a better future for everyone. Before I conclude, I would like to extend an invitation to Mr. McDonald and other stakeholders to join us at Edgemoor for a meeting to address our collective concerns. Thank you.
Thank you. As the next speaker is coming forward, I'd like to invite 5 additional speakers in favor: Mary Jo Scarpiti, Robin Sales, Logan Government, Maria Veloz, and Greg Angel. If I've called your name, please come forward.
Hello, Board of Supervisors. My name is Josh Bohanan, and I'm with Father Joe's Villages. Father Joe's is San Diego's largest and oldest homeless services provider, and we are here today in support of item 14. So not only is Father Joe's do we operate shelters and we are an affordable housing developer, we also manage a federally qualified health center and recuperative care beds. And we know that recuperative care beds are a critical component to addressing the homelessness crisis. These beds allow people before or after medical treatment time to recover and regroup their lives, connect to social services, connect to housing, connect to other forms of shelter. And if these individuals do not have access to recuperative care after their medical treatment, some of these individuals might end up back on the street, which I think all of us know is not the best outcome for people. No matter what health condition you're going through, if you go to a hospital stay, it's important that you have the wraparound services and time to recover. Recuperative care does just that. And when we talk about the homeless population, we know that individuals experiencing homelessness, they'll present 10 years older medically than their housed peers. So they're more likely to experience health conditions, they're more likely to have comorbidities, and are more likely to need other forms of treatment. And as we look forward, we know that our seniors are the fastest growing population experiencing homelessness. And this population group will also need different levels of medical care throughout their lifetime. So when we think about meeting the need in the future and what we need to do today, if we start investing in building these recuperative care beds in the immediacy, we'll be able to keep up with the need as it goes in the future. But unless we do that today, we're going to keep falling behind, especially as the senior population, who's the fastest growing homeless population, continues to increase. So today we ask for your support, item 14, focusing on recuperative care beds. Thank you.
Thank you. Next speaker, please.
I'm Ruth Bruland, and I'm also from Father Joe's Villages. I have worked for Father Joe's Villages since 1998, so I've seen a few things, and I'm here today to be in support of this item because I've seen a few things. Being at Father Joe's, I have seen what it is like before having our own recuperative care beds and now after we have had our small recuperative care program, but we've had it for a while. And the difference is just huge. It wasn't that long ago that we would have hospitals who are absolutely desperate to make room in their hospital for people who very, very badly needed a bed for the first time, that they had somebody that had been in that bed and they needed to get them out of that bed, that they would show up at our site, sometimes with IV still in their arm, dropped off by a taxi, with the hospital just daring to hope that we would have space for them at the village. Sometimes we did, sometimes we didn't. Having a recuperative care program, having more recuperative care programs is really a humanitarian issue in that it makes a huge difference for that person who, for perhaps it's a life or death situation, or it's a get well more quickly, or take forever to get well and are back and forth in the shelter and back on the street potentially. For someone who has to have a test done that is pretty invasive, a colonoscopy, for example, to not have a place where they can go, where there's a bathroom that they can count on and have that privacy to prepare for that test, those tests don't happen. The risk for colon cancer, other issues, goes up higher and higher without that recuperative care program being available for them. It makes a big difference on that humanitarian level, but it also is a wise business decision. So I encourage you to support this item because for the hospitals who are really working hard to support our ever-growing community, they run out of space. If we have more recuperative care beds, those patients who are ready for a lower level of care can access those beds and therefore make more room in the hospitals for those people who really need that higher level of care. So I thank you for your consideration of this item. It's a critical issue, and I hope you will find yourself supporting it. Thank you.
Thank you. Next speaker, please.
Hi, my name is Robin Sales. I'm the chair of the Behavioral Health Advisory Board for 2024-2025. I'm a retired licensed clinical social worker and live in District 3. Today I'm speaking for myself because this item did not come before the BHAB in time for us to make a decision as a group. But I can safely say that one of our priorities has been and will be the behavioral health workforce. We believe it is really important to provide high-quality behavioral health care in this county. We also appreciate Supervisor Lawson-Remer's vision and passion for improving the lives of the unhoused and incarcerated individuals, and we know it can only be achieved if we have sufficient number of behavioral health workers in this county. We can prevent people from being incarcerated and having negative outcomes in our jails. We can prevent people being homeless and show compassionate care. In my almost 40-year career, at the end of my career, I was working for Kaiser Permanente Department of Psychiatry as a clinician, also as a union steward. I have to say that even though clinicians were paid sufficiently at Kaiser, they often worked 3 or 4 hours every night to complete their paperwork. There are many, many tasks that trained behavioral health workers could be doing that it would alleviate the load on licensed clinicians. In the primary care setting, for example, if we had embedded behavioral health workers, they could actually prevent referrals to the Department of Psychiatry with early intervention. And we know that the primary care doctors at Kaiser depended on the clinicians at the Behavioral Health Department, the Department of Psychiatry, to give them direction. And I really believe that if we trained enough workers to a sufficient level, they'd be able to take some of that load and to intervene in a culturally appropriate and equitable way. I also think that getting relevant behavioral health care in the community is so important. There are a lot of big providers of mental health services and behavioral health services in San Diego County, but the smaller operations need support. We can help elevate people's salaries. We can improve people's standard of living who are behavioral health workers, as our SEIU employees were able to say. We on the BHAB know that in order to have a strong continuum of care, highly trained workers are needed now. I urge the Board of Supervisors to earmark $24 million from the Evergreen funds to provide training, tuition support, and financial incentives, and provide opportunities for career advancement to those who have a passion for helping others in their communities. Thank you.
Next speaker, please.
Hello, Board of Supervisors. My name is Logan Government, and I'm here on behalf of Interfaith Community Services. I'm here today to support item 14 and help provide a better understanding of recuperative care. Recuperative care centers provide people with a place to heal and access available resources. The first question you might ask is, what is recuperative care? Recuperative care is a place where homeless individuals with high medical and behavioral health needs can recover and find stable housing. Meanwhile, in San Diego County alone, 1,135 people became homeless for the first time in just the month of November. Recuperative care beds are needed now more than ever. I want to share a small statement from our clinical program manager, Stephanie. It has been amazing to see RCP, our Turk Center, expand from a 32-bed facility to a 106-bed facility. Being able to help more people is always a goal to those working in social services. The Turk Center is a therapeutic environment where clients can come to rest and recuperate. Recuperative care provides a safe place for individuals to focus on their individual goals. Our amazing case managers work hard every day to assist clients, address their different needs. They create individual treatment plans based on goals the clients want to work towards. Our program is client-focused. We have an incredible nursing team that meets with clients on a regular basis. They help provide education about recent diagnosis a client may have or medications prescribed to a client. The Turk Center provides a safe place for clients to heal in many different ways, but more importantly, ways they need to be successful after the program. Thank you.
Thank you. Next speaker, please.
Hi, my name is Maria. I'm one of the case managers at the Recuperative Care Program, speaking on item 14. I've had the privilege of working with both our CalAIM and our veteran clients. During my time at this facility, I have gotten to see the benefits of having a program such as Recuperative Care. This program allows individuals who are exiting from either a medical or mental health facility into a safe place where otherwise they would end up on the street. We have had a range of medical conditions from PTSD, broken bones, to congestive heart failure, to double amputations, and to even having clients being placed on hospice. On their own, these medical ailments can seem daunting to address alone, let alone receiving these diagnoses and just being discharged immediately to the street. An environment that does not allow for one to address any medical concerns, such as shelter and surviving, is a top priority. Our jobs as case managers allow us to meet with our clients once a week to be able to focus on their needs. Some of their needs are either getting into a rehabilitation center, working on their sobriety, or even connecting with relatives and making sure they can focus on their medical needs. Without a safe place to be able to center themselves and focus on their needs, the chances of an individual re-entering the hospital are high. Several of the insurances we provide services through won't even refer an individual to us unless they've been hospitalized a minimum of 6 times within a few months. The high utilization means prior to coming to RCP, our clients are not able to stabilize their health, causing a further decline, as well as adding further strain to our hospital systems. Thanks to collaborating efforts with medical programs, we're able to alleviate the strain of having our clients referred to a safe environment. As a case manager, I've heard that without without a program such as Recuperative Care, they would be overwhelmed and wouldn't know where to begin. However, the task is only made easier for us as case managers if we have clients that have a safe place to sleep, food to eat, and a bathroom to be able to take care of their personal needs. I have a letter from one of our clients who recently graduated our program and is currently in permanent housing. Dearest people of interest, my name is Scott. I am writing this letter with profound gratitude and immense appreciation for a life-changing support I have received during my 8 months at RCP. The program is a beacon of hope guiding me through some of the darkest moments in my life. The unwavering commitment to helping individuals in need is evident in every interaction. At the program, I was able to receive comprehensive therapy for my PTSD, assistance with overcoming opiate addiction, and invaluable support during my moments of suicidal thoughts that have been crucial in rebuilding my life. I was not only able to have a safe haven, but also felt empowered to rediscover my strength and resilience. With more places like Recuperative Care, our world would undoubtedly be kinder and a more compassionate place. Organization stands as a shining example of a positive impact that dedicated individuals can have on those in need. With the help of my case manager, Catherine, we were able to set and accomplish goals on a weekly basis that would have been impossible to do if I was alone or on the street, along with the rest of the amazing staff who are always kind and helpful to me, even at times when I was the biggest brat in the whole place. Thank you from the depths of my heart for being a guiding light to lead me out of darkness, and I truly appreciate having a recuperative care program to be able to rest my head. With sincere gratitude. Thank you.
Thank you. As the next speaker is coming forward, I'd like to invite 5 additional speakers in favor. Jordan Bean, Julie Porter, Natalie Rashke, Rachel Hayes, and John Brady.
Good afternoon, honorable supervisors. My name is Greg Angel. I serve as the CEO at Interfaith Community Services. Interfaith Community Services has developed more than 75 programs to help people overcome poverty and increasingly homelessness. We do this in partnership with hundreds of local faith communities, hundreds of professionals like Ms. Fellows, who just spoke, who dedicate their career to helping others, thousands of volunteers, and partnerships with county, local, federal, and state government. Through those programs and services, Interfaith helped more than 1,400 individuals overcome homelessness just this last year. 1,400 individuals. It's a tremendous amount. 75 programs takes a lot to operate and provide and help that amount of individuals overcome homelessness. Almost every single one of those programs requires ongoing support from community members through charitable contributions and often local government support. There is one exception, and it's what I wanted to come here to speak with you all about today, and that is our Recuperative Care program, which has been described. It formerly operated as a 32-bed center with contracts with our North County hospitals, Tri-City Medical Center, and Palomar Health, as well as our local VA Medical Center. This board and the county saw the opportunity to invest in expanding that proven effective program to serve and help more people exiting hospitals who are homeless. The University of California, San Francisco conducted a landmark study on homelessness. Medical doctor Margot Kuschel found that statewide in the state of California, 1 out of every 3 individuals who were unsheltered had been in a hospital emergency room in the last 6 months. So when we think about 10,000 plus people homeless here in San Diego, 40,000 who tried to overcome their homelessness, 1 out of every 3 have been in the emergency room in the last 6 months. What if rather than discharging these individuals to the streets after a time of crisis, what if they were able to be discharged into a place of care that provided 24/7 support with registered nurses, licensed vocational nurses, certified nursing assistants, master's level case managers, licensed behavioral health clinicians, 24/7 behavioral health aides? What if we could do that and actually help more than 75% of those individuals graduate out of that recuperative care into stable housing, with more than 90% stabilizing the medical or behavioral health condition that landed them in the hospital in the first place? That's exactly what we together have done. The County of San Diego, Interfaith Community Services, our partners at local hospitals, now in support and working in partnership with all 7 local Medi-Cal managed care plans. Not only is this program proven successful, and through the expansion supported by the County of San Diego, we now operate the 106-bed Abraham and Lillian Turk Recuperative Care Center in Escondido. We do this without the need for any ongoing operating subsidy from the County of San Diego. It was a one-time investment of funds that helped create the center, a $9 million investment, which we leveraged with an additional $8 million of private support to create the 106-bed center operating successfully today. We're nearly at capacity. We project being at capacity within the next 6 months, and we are in North County, San Diego. Supervisor Desmond, as you shared, it's a long drive down, right? Not everyone who is referred to our program is going to be successful coming there, so it makes all the sense in the world to invest one-time funds to create more centers, to serve more individuals throughout the county successfully together. Thank you for your time. Thank you for consideration.
Next speaker, please.
Good afternoon. Hi, my name is Kim Barrows. I'm the manager of the Recuperative Care program at Father Joe's Villages. I am in support of item 14 because I have witnessed much success with recuperative care by our team, offering a safe place to sleep and recover, getting them connected with a primary care doctor and specialists, setting up transportation to get to their medical appointments, and for some, obtaining permanent housing. Without enough recuperative care beds, these individuals will be discharged to the streets with no support or stuck in an emergency room where space is extremely limited. Thank you for your time.
Next speaker, please.
Good afternoon, Supervisors. My name is Jordan Bean. I'm the Chief of Staff with the Regional Task Force on Homelessness. Happy to be here today in support of item 14, using ARPA funding for the creation of more recuperative care beds and centers in San Diego County. This is from the RTFH's regional plan. Recuperative Care provides short-term shelter with medical services for individuals experiencing homelessness who no longer need an acute hospital setting, but still need a safe and supportive environment to heal. San Diego has various respite care programs, such as Interfaith Community Service Model in North County. While these programs are not specifically targeted to seniors, it is a needed service for older adults facing homelessness, given their complex health issues. To return to some of the sobering data you've heard around senior homelessness during our last point in time count, we found that people 55 or older now make up 29% of our unsheltered population, with 46% of those experiencing homelessness for the first time. RTFH fully supports the expansion of these beds and hopes the Board of Supervisors will take this opportunity today to vote yes on item 14. Thank you for your time and consideration.
Thank you. Next speaker, please.
Hi, I'm Rachel Hayes. I work with Lived Experience Advisors, and I support item 14, recuperative care beds. It's not just about the people that are getting out of the hospitals. I know a lot of homeless people that have delayed getting medical attention because they have nowhere to go afterwards. And they're back out on the streets after the hospital and having to tend to themselves or not having anyone to take care of them. And that's just sad that they're delaying their medical needs because they're scared they're not going to have anywhere to go afterwards when they need the recuperative care. Thank you.
Next speaker, please.
Good afternoon, everyone. Thank you, John Brady with Lived Experience Advisors. It's good to see you all again. You know, I come to you, I've been doing this work for 5 years, advocating for people experiencing homelessness, and there's a lot of things that I'm really tired of. I mean, I'm tired of seeing the numbers go up. I'm tired of leadership at a state and federal level saying we're expanding and we're investing more money than ever. How come you're not solving homelessness? I'm tired of having to counter classic tropes. The reason people are homeless is because they've got mental health or drug addiction issues. I'm tired of people dying on our streets, of which we honored 600 just last year at World Homeless Day. But one of the biggest things that I'm tired of hearing about is somebody that needs medical care, has been referred to medical care and cannot get the surgery and therefore dies on our streets. And I got to go to 2 of those funerals last year because we did not have enough recuperative health care beds. We desperately need those, and we desperately need to solve our behavioral health problem. As I mentioned earlier, after a year and a half on our streets, and with a disabling condition, which is the majority of people that are on our streets, you become chronically homeless. And once you're chronically homeless, it is a downward spiral from there. You may not have had mental health or addiction issues before you became chronically homeless, but after a year on our streets, those things crop up. You may turn to drugs and alcohol because that's the only thing that can resolve the pain of not living under a roof. And shelter is not the end of that. We do not consider the end of chronically homeless until you're in housing. We have got to focus on housing, and I know that there may be, I don't know if it's a competing funding opportunity to invest in housing, and this may be the only time you ever see us up here saying this is something that we need more than housing. We need more behavioral health workers. We're short 18,500 workers. That's a stunning number. That's almost the population of a majority of most towns in America. That's a lot of people that we need. I know that we need it because I hear time and time again people on the streets who desperately need therapists can't get therapy. If you can't get therapy, you can't begin the recovery process. If you can't get therapy and medication, you may never recover. Or you may end up in the court of last resort, which has its own problems, care court, which is inaptly named because there's no care funding to go with the court. So because you were not able to access treatment when you needed it, when you were asking for it, you're going to end up legislated into a reduction of your rights. And I'm tired of that too. I'm tired of the fact that because we don't have enough housing, we're creating ordinances to make it illegal for people to survive when there is not adequate shelter even to begin with. So please vote yes on this. please say yes. We need health care. We desperately need health care on our streets. We've got to get people off our streets. We've got to get them taken care of. And we need to build the housing yesterday. And it is not enough. I know everyone here feels that we're doing everything possible to build more housing, but it is completely inadequate. In the city of San Diego alone last year, we didn't even build half of the required housing to stay where we are. And without the housing, there is no end to homelessness. Thank you so much.
As the next speaker is coming forward, I'd like to invite the remaining speakers in favor: Flower Alvarez Lopez, Crystal Irving, and Richard Ciaba.
Hi, my name is Natalie Raschke with Lived Experience Advisors. I can tell you firsthand, mentally, emotionally, and physically, what homelessness will do to somebody. When first becoming unhoused, I was mentally, emotionally, I felt a strong individual. I know after 2.5 years, that really makes you question your ability to think who you are, who you thought you were, and to make choices that are best for you. I have a dear friend right now who has become unhoused for the first time, who had minor medical issues. They have intensified since then. She needs some recuperative care. At this point, she just wants to die. She wants to die. That's somebody's daughter, somebody's friend who just needs a place to recuperate. And now she's unhoused and doesn't have that. As the others said about humanitarian, who wants to watch somebody say they want to die? You guys have the choice to help people not feel that way. There were never times that I wanted to die, but to think about somebody who has gotten to the point emotionally, physically, and mentally that just is questioning their life and what it's worth is very sad to me. Thank you.
Thank you. Next speaker, please.
Hello again, Julie Porter with Lived Experience Advisors. While listening to these stories, I realized I was on the end of that. I had to find a motel room so I could prep for my colonoscopy. Luckily, we had the money to do that at that time, but many people don't, so they'll put it off. I was exited out of a long-term care facility with nowhere to turn. Some of the workers there were saying, I'll make a place in my garage for you. Of course, that couldn't happen, but they exited me because I asked questions about some of the things that were going on in this long-term care facility. I went to that place after the hospital, but where did I go from the long-term care facility? They dropped me off at 299 17th Street. Many of you know that place as Neil Good. There's no housing at Neil Good. But anyway, I did get through it, thankfully. I urge you to vote yes on 14. Thank you for listening to me again. Thank you.
Thank you. Next speaker, please.
Hi, Richard Ciaba, representative here for Lived Experience Advisors, and I'm here to show support on item 14 about recuperative care for unhoused individuals. And I think it's really important as a as a homeless individual as I once was, that it's important to know that there's people out there who require a place to recover after our medical procedures or even behavioral health procedures or stuff like that. People who don't have a house, it's important for them not to be thrown out onto the street after an important medical procedure that requires them to bed rest and requires, you know, some kind of structure, some kind of place to stay in order for their conditions not to be exacerbated or made worse by the conditions of the streets and not being able to be somewhere that they can, you know, really take care of themselves. And like that was said before through some of these other people with lived experience said, sometimes people put off medical procedures because they don't have that to look forward to. There's, you know, there's multiple different procedures that require different types of recuperative care, not only physical or surgical, behavioral as well. So, you know, like I said again, I'm here for supporting of item number 14 for recuperative care for our unhoused individuals. I don't know how much of the funding from the Evergreen funding is needed for more recuperative care. I don't know those numbers exactly, but I just, you know, want you to take into consideration when you're divvying up those funds where those are going to go. Thank you.
Thank you. Next speaker.
Hello, Chairwoman Vargas and Board of Supervisors. My name is Crystal Irving, and I'm proud to serve as president of SEIU Local 221, representing over 13,000 workers in this region, and I'm here today speaking in favor of item 14. For the past few months, we have been advocating for relief from Kaiser's rising costs in healthcare, and you've heard the experiences and the stories of our members, how these rising healthcare costs, in addition to the rising costs to simply live, have been impacting their day-to-day lives. Our members continue to provide the critical services that keep our county running while being concerned about their ability or inability to meet their daily needs and the stress they're experiencing trying to make that happen. Our members need this, and our workforce needs this. Now, our members appreciate how often you thank and acknowledge them for their contributions to our county and the communities we get to serve. And bringing relief to the workforce by closing the healthcare gap would be a demonstration of how much you appreciate their work and dedication beyond just words, but with action. And as far as the behavioral health investment, the board letter has a broad focus, but really speaks to the issues that our members have long raised. Supporting healthcare staff includes better pay. It includes elevating the voice of workers in the workplace, support programs like tuition assistance, bringing relief by addressing and preventing burnout, and ensuring safe conditions for our workers and patients, as you've heard from a few of our members today. And housing for community and workforce is always a win for communities, especially after hearing from some of our community advocates today. And I want to just take a moment to thank everyone who has shared their personal stories today, because I know that that is not always easy, and it's a very brave thing to do. So I just wanted to thank them and acknowledge that. And again, I urge you to vote yes on agenda item 14. Thank you.
Thank you. Next speaker, please.
Hello, my name is Flower Alvarez Lopez. I'm with Universidad Popular, an organization that works with hard-to-reach and vulnerable populations within our community. We're based out of District 5. Anytime we support and empower struggling and vulnerable community members, we're investing in our future and in our foundation. I would like to request that asylum seekers in San Diego be added to the list of populations that can access support. We have been responding to the humanitarian aid crisis in District 1 and District 2 on the U.S. side of the border. We have been supporting the street release sites. I was just at the migrant center that you all helped start yesterday. A wraparound support system will make it better. I hope you all support item 14 and allow it to be flexible enough to invest in as many San Diegans as possible. Thank you.
Thank you. Final call for Mary Jo Scarpiti. We'll now hear from those that are in opposition of this item. As your name is called, please come forward. I'd like to invite Gambler, Paul the Bold, Audra, Consuelo, and Mark. If I've called your name, please come forward.
Consuelo, the epitome of bribery. Ask why more seniors are now homeless. This is all by design, all of it. The same entity you come here to beg continues to have you fooled into believing they are doing all they can to solve the issue. Pay attention. Don't you see it? You state the obvious here at the podium, yet you don't seem to quite get it for some reason. Government is the reason for all of our problems. I mean, it's incredible to witness people here begging government assistance. They're worse than pimps. At least a pimp takes care of its hose. Government has you all believing they're saving. I'm on.
Can you tell me, I just need to know what topic, what number are you speaking on?
I fused them together. Yeah, she just wanted to stop me off my track because I was on a roll. At least pimps take care of their hoes. Government has you all believing they're the savior in spite of their track record. You heard the earlier calls. You see. Oh, shit, I lost my spot. Thank you, Nora.
All right, well, just I'm letting you know that you are off topic, and this is the third time you're on topic, so I'm letting you know. You are off topic, so focus on number 12, 13, or 14. You have...
Zip, you work for us.
3 items.
Get it straight, you work for the people. You don't like what I'm saying, that's all. You don't like what I'm saying, I'm sorry, this is not Tijuana, this is San Diego County, baby. Get used to it.
All right, so just so you know that this is your third warning, you have exceeded your time, so please go ahead and leave the podium. Yes, go ahead. Hey, listen, I'm not asking your opinion. You have to leave. All right, we're going to go ahead and take a recess. We're going to ask everybody to clear the gallery. Thank you. All right, go ahead, sir.
Thank you, Chairwoman. I'm going to go ahead and recall the speakers, the remaining speakers in person: Gambler, Paul the Bold, Audra, and Mark. If I've called your name, please come forward. Justin, come on up.
Give me a second.
If I've called your name, please come forward.
Is he speaking or not? No, there's.
If I've called your name, please come forward.
Do we want to wait until everyone gets in before we talk? Or
Go
we
ahead,
really
sir.
don't
I have
care?
already started meeting. You're next.
Ask you to please state your name for the audio record.
Gambler. It's kind of messed up the fact that all three of these items are all tied together. Because one of these items is the key reason why I think some of these people are elected, for the full purpose of redeveloping land. I mean, now we're calling ADUs, you know, granny flats? We have 1,500 projects. And we are cutting off $15 million in fees? That does not sound like 15,000 granny flats. That sounds like apartment complexes. You want me to believe you guys are here for us? The way you treat people, Nora? The way if you disagree with anyone, and we are not a democracy. We're a republic, by the way. Right. I don't understand if you guys, do you understand what you don't even know what the fuck you guys are talking about, and which is beyond belief. And I'm not a straight A student. You guys went to college, and you don't know this shit. We did the Pledge of Allegiance, and then you call it a democracy. How freaking stupid can someone be? You would probably lost your own job because you wouldn't speak up about the elections. How stupid do you feel?
Justin, so I'm going to give you a reminder that you have to stay on topic. The items before you are 12, 13, and 14.
Yeah. I believe that you are shipping homeless people into different areas in the disguise of helping them. Shipping them out to district number 5, shipping them out to district number 2, getting them re-registered. Who gives a shit what happens to them after that? Because you got everything you needed. You got a bunch of ballots in a location that would not normally have a good group of ballots. So do I believe that Joel will be here the next election? Hell no. After this election, he's gone. He's replaced. Tara has a 50-50 shot to beat Kevin, and you are pretty much right now safe unless if I do something about it. That's the truth. There's nothing you could do to stop me because you guys defend voter fraud in the elections. That's the statement. I've said it. I told you guys on May 23rd how to commit voter fraud, and you did nothing about it. Matter of fact, the very next day, I mean, that was the same day ACLU came over here to root for Monica. So I know they all know how to commit voter fraud. There was a shitload of them
All
here.
right, Justin, I gave you another chance. You already had 2 off topics. So I'm going to ask you, I'm going to read the information here for you.
This has to do with item number...
Item 13 has nothing to do with elections.
Moving people around in order to cheat the elections, I think is a problem. And using it under the disguise of these 3 things, I think that's a major problem. And if you don't agree with me, you cannot stop me from talking. What part of that do you not understand? Do you not understand that? Seriously.
Next speaker, please.
That's me. The number 12.
Can you please state your name?
Oh, Paul Bold, sorry. I thought you knew me. The presentation for number 12 question mentioned only 10 out of the $80.6 million actually for COVID stuff. ARPA is basically COVID money that was allocated for COVID stuff. COVID is pretty much behind us. It is more like a flu or cold than a killer disease. The vast majority of COVID deaths are now like people who die with it rather than from it, which is why people, by the way, should not be shot up with foreign substances like mRNA. But there is no reason not to give back the money which was for COVID. Reduce the federal debt a bit. I mean, the board letter says that the funds are to be used for investing in our future, and I disagree that that's a proper use. 14, the Evergreen Fund business. None of the framework's programs mention COVID and do not address COVID-related issues. The letter singles out Program 3, provide critically needed step-down beds, for immediate action. Hospitals are already struggling to meet the increasing demands of ER patients needing involuntary treatment, further exacerbated by the current lack of post-acute care resources. This leads to patients languishing in the ER, NORA, for days, awaiting treatment at a county facility. That is, there are not enough resources or personnel in place to implement this immediately, even if the beds are provided. Providing more step-down beds is only one thing that is needed. Personnel, legal backup, and community involvement are even more important. The Senate bill this is based on also includes personal safety and necessary medical care as part of basic personal needs. By making the definition so nebulous, it opens the door to legal abuse, and police, paramedics, and your lawyers could end up as busy as before. So, again, none of the 7 programs in the report have anything to do with COVID. So it is an outrage to use the tax dollars that we give the federal government for these purposes at the county level. Another note, if you combine items that are for discussion, if you combine them and limit the time, people get confused, and that's probably why you get a lot of off-topic speakers. Thank you.
Thank you. Next speaker, please.
Mark, the Chief Administrative Officer should recommend that any remaining ARPA funds be distributed for education of people on these topics. The times on these YouTube videos are listed below, or a lot of it anyways, $10, $20 million, until everyone knows, or most people. Also distributed in the form of back pay for any policemen, firemen, or public employees whose careers and families were damaged by the county's extreme overreach and abuse of power and experimental coercion during the pandemic. They should be reimbursed and hired back immediately if they choose. Also, any people who were injured or died from the COVID-19 vaccine should be paid a huge settlement, and those officials who promote this ultra vires should be held accountable. Also, any businesses forced to shut down should be reimbursed for their losses, and FEMA should not be permitted disallowances pertaining to these obligations. This is the greatest possible example of ultra vires, meaning beyond the powers. and these officials should be arrested by Sheriff Martinez and given a fair trial. If your sworn duty, it was your sworn duty to refuse to enforce these mandates, as Sutter County Sheriff is refusing to enforce unconstitutional gun laws now. What is truly disturbing is that some of you may not even realize that your most important job during the pandemic was to defend our Bill of Rights, and you betrayed us. However tragic the many COVID deaths were, at the height of the pandemic, about 1 out of 650 people died here in California. Since 1 out of 115 was the normal pre-pandemic annual rate of death from all causes put together, your solution was catastrophically worse for our economy and well-being, and falsely led American children to believe that you have the right to tell people whether they can work or what they must inject into their bodies to keep their job and support their families. The very kind of tyranny British kings unleashed that our forefathers broke away from in an attempt to free us here in the U.S. Because of your ignorance, lack of leadership, and cowardice, this new level of total domination is all our 9-year-old children can remember now. Priceless liberties our ancestors died to give us and our children, and you've trampled them. And every moment you have the chance to do the right thing now. 13, while I do not oppose getting rid of fees for the public, building accessory dwelling units without stopping inflation only lowers our standard of living, which is the real intention of the government to control us. This is a title to an article. Wall Street-backed landlord buys 264 Las Vegas homes, a $98 million deal, even though Sin City has nation's worst housing shortage. As study shows, corporate sharks could own 40% of all U.S. homes by 2030. Our government makes money from the homelessness they create. 14, your overview states the commitments and actions of the board are moving us forward towards a more equitable and inclusive future for those who live and work in San Diego County. This is a lie. Program 6 is an unsustainable scam which subsidizes part of the people's rent with tax dollars through vouchers instead of simply lowering the cost of rent for the low-income housing. Because corporate profit, control, and a transfer of taxpayer wealth is your real purpose. You ignore the key cause of homelessness, which is inflation, so any solution is impossible, just as intended. Program 4 supports the pharmaceutical industry's experimentation on our homeless, whom you are now planning to incarcerate under LPS conservatorships, while intentionally causing their homelessness through inflation, which you refuse to stop or even address, something our founding fathers vehemently opposed and warned about. Your own document states in Section 5, the county is facing a rapid increase in health care costs for the upcoming fiscal year 2024-25, end quote. But Newsom is adding $3 billion to our $68 billion deficit with free health care for illegal aliens, while our citizens are stressed out and homeless, just as Thomas Jefferson said they would be if the American people ever allowed private banks to control the issue of their currency. They have. Program 7 is a fascist partnership between the federal government and small businesses.
Thank you. Next speaker, please.
My person uses the name Audra. I'm wondering if the sheriff's outsider for me. Who knows? This is sad because all of those who support this are engaging in bribes. The unions are being bribed to do this, and it's illegal. And so each will be individually liable for their actions. And Evergreen is, if anybody knows, a Clinton Foundation, entity, and they are involved in human trafficking. But also, when we say Evergreen, it's like this fund is evergreen, and so we can use it for whatever we want. These are funds for COVID, the made-up, invisible killer dot disease that they wanted people to believe existed so they would go inject themselves with a bioweapon. Right, Jim? Is that why you're not well? I don't know. It's really sad because it's sad to see you not looking as good as that you have. And there's things that people don't want to acknowledge. And all of these funds should be used for COVID things, right? But as long as you make it an evergreen fund and you're like, we're going to use it for behavioral health, and because COVID affected that, right? Or was it you guys? You guys are COVID. You're the ones that are locking things down, making people lose their jobs, making lives be turned upside down, making people who come in to try and redress their government be either arrested, forced out, whatever it is, right? Beat up in the hallway. whatever needs to happen to shut the people up. I mean, even when Nathan was here, right, you guys had this whole misinformation, disinformation campaign. As long as the people came in and told truth about what was really going on, you had to discredit them and discount them and shut them up and say this isn't the truth. Oh, while lying to the people. That's why these funds should actually be used for people who have been affected by the bioweapons like Jim, who took it. And if you could acknowledge it, then you would understand that maybe things that are in your health don't have anything to do with growing older or whatever, but it's something that you injected yourself with that maybe you shouldn't have done. But you believe the government that was here to help you, right? They give you all this propaganda to be like, we're here to help the county. But Helen, it doesn't matter how many billions of dollars we spend in this county, everything is going to shit. People can see it. All you have to do is look around and look who's running the county. Where does the money go? What's happening? And Jim, it's like this is talking about going to illegal immigrants. Are you going to do and pass this? Are you guys going to pass it in one motion? Because you'll sit there and you'll go on Twitter and all this other stuff and say that, you know, the federal government needs to take care of this. But then you're willing to give the funds, just like when you said there's $6 million in my bank account, that you're willing to keep us in an emergency or continue to use PCR tests that do not work because you get money for it. That's blood money, what you guys are throwing around. It's very sad. Because you don't have a soul if you can't look at what you're doing and look in the mirror and it's like you guys think like I'm doing such a great job. Pat myself on the back, right? Because you got money in your bank account that's been sold, the souls of the people that you are supposed to represent. It is extremely terrifying to think about where this county is going in this next new year that doesn't even start until a few months from now. So good luck when you're asking God where you're going to go and when he tells you, turn.
Thank you. Now we'll hear from the individuals that requested to speak by phone. When it is your turn to speak, you will be unmuted and you will hear a recording that will tell you to begin your comments after the beep. I'll remind the callers they should mute their TV or live video stream before they begin speaking. We'll start with our first caller.
Thank you, Chair Vargas and the Board of Supervisors. I am San Diego City Council President Pro Tem Joe LaCava. I have the honor of representing the communities of District 1. I want to thank the board for your work on homelessness, behavioral health, climate, and affordable housing. These crises cannot be solved alone, and I'm grateful for the partnership with the city and the county. Together, we appreciate the magnitude of the challenges before us and recognize the regional solutions we must apply. Among those pressing issues is the dire need for more recuperative care beds in our county. Whether called recuperative care, step-down, or post-hospitalization, the pathway to housing for someone needing medical care is not on our streets, not in our shelters, nor in our hospitals. And sadly, we are short hundreds of beds for that recuperative care. The model through CalAIM and our health plans is there. We need the infrastructure to make it possible. Outside the hospitals in my district and across the city of San Diego, we see homeless, discharged patients unable to care for themselves without adequate support and the lack of shelter. They suffer, and their ability to resolve their homelessness is impossible. Thankfully, recuperative care is a safe, successful, and cost-effective model that works, and we should support the expansion of this program. I thank Vice Chair Lawson Reamer for her leadership on this issue and bringing forward program recommendation number 3 to be supported by the Evergreen Fund. I have seen firsthand the value of the Recuperative Care Center operated by Interfaith Community Services in Escondido, and your investment in the Turk Center will be life-changing for hundreds of people in need of safe recovery and ultimately housing. We need affordable housing, we need behavioral health treatment, and we need recuperative care beds for our most vulnerable. This is reaching a crisis level in our county and in our city, and I thank again Vice Chair Lawson Reamer for her leadership to invest in the desperately needed capital infrastructure for this program. I urge the board to support the Vice Chair's recommendation and stand willing to support your efforts at the city. Thank you for the time.
Thank you. Now hear from the next caller.
Hello, Alan C. here. I'm actually speaking on 12, 13, and 14, if you can adjust my time according to board clerk. Yeah, funny, Joe Cava just got off the phone, City Council. Didn't you guys just vote down a 550-bed shelter last year, also along with the new supervisor, Montgomery? That was a 550-bed shelter you shut down, kicked people out on the street. Okay, let's look at some real irony here. Health and Inhumane Services overseeing American Rescue Funds that advised the county locked down our business last few years, yet the county did not stop the taxes. The taxes business paid, some went out of business, are now going back to the government to decide who are the winners and losers. Real bit of irony there. If HSA really cares, why don't you come on down tonight? I'm going to be speaking to Chula Vista City Council about the disaster down your Oxford Street HSA building, how it's causing a homeless magnet. Come down and look at real solutions. Unlike that Golden Hole that got shut down, we're looking at the TRICARE building right next door on the other side of Costco. What will you guys do to make action happen? Let me tell you a story how bad it is down in Chula Vista, right behind Walmart. Your HSA building, as the magnet has said, right across the street is the blood plasma donation center. That's where the homeless get their money, the drug tents. $400 for 4 pints. They walk up the street, there's not one but 4 tables of free California phones. Thank you, taxpayers. So they get the phones, get the drug deals. They walk up a little further to Council Cardenas, 2, not 1, but 2 cannabis shops in the same parking lot. In the same parking lot, there's also 2 fitness centers. Young women go to work out while there's drug tents sitting next door. Well, the HSA come down and make a difference. Well, Chair Vargas, your district come down and make a difference. Because that's when you take real action, when you care. And to all the health professionals in the room, I bless you, but let's start doing the right thing. Go after fentanyl and opioids and all these other addictive painkillers that are prescribed in the hospitals. You want to make a difference? Let's outlaw fentanyl, outlaw opioids. There's where you make a difference. And Father Joe's, I ask you also to come down and look at that TRICARE building because we need shelters, not affordable housing. It takes 10 years and only service 10, 20 people. We can service 300 people in that TRICARE building that's sitting next door, just like Golden Hall serviced 550 people that you guys failed, and you could have made a difference. Had you enforced the rules and got them a job, not treatment and housing, but a job. Get a sense of self-worth, then you self-satisfaction. That's how you break the cycle, you idiots. I yield back.
Thank you. Now hear from the next caller.
Good afternoon. My name is Jason Anderson. I'm calling on behalf of Clean Tech San Diego. I first want to congratulate Chairwoman Vargas on your leadership position. Well deserved. I'm calling in support of Agenda Item 14, specifically the component that would create 2 programs to accelerate the growth of our regional clean tech economy by helping to secure more state and federal resources and support regional energy innovation. Clean Tech San Diego is a member-based business organization founded 17 years ago to position the greater San Diego region as a global leader in the clean tech economy. Our members include more than 130 businesses, universities, governments, and nonprofits committed to advancing sustainable solutions for the benefit of the economy and the environment. We represent an industry that employs close to 40,000 people in our region and has about a $9 billion impact on our regional economy. In 2016, Clean Tech San Diego launched the Southern California Energy Innovation Network with the support of the California Energy Commission. That program provides free resources through a consortium of regional partner organizations to help energy entrepreneurs successfully bring their innovations to market. To date, 73 companies have been served by SEEN, 36 of which are active in the program. Together, these startups employ close to 1,000 people, have had 469 patents approved, and have raised over $418 million in follow-on funding from public and private resources. It's also worth noting that 86% of SEEN companies have female, minority, or veteran representation on their C-suite leadership team. Access to funding from a variety of resources is critical for the continued success of not only these entrepreneurs that we work with, but other small businesses in the region as well. We believe this proposal will help advance energy innovation in our region while also supporting the regional economy. The proposal will play a pivotal role in securing the San Diego region's fair share of grant resources and supporting energy innovation, again, benefiting both our environment and our economy. Thanks in advance for your support.
Thank you. Now hear from the next caller.
Hi, my name is Levi Giaffleone with Lived Experience Advisors. I experienced homelessness myself for approximately 6 years and ended up finding out that I really had a passion for working with people who experienced the same thing that I did or similar experiences as homelessness. And so last year I was working at a women's shelter that was coming to an end, coming to a close. And like, while I've had so many clients who desperately needed recuperative care, this one hit extra hard because we had a client who, she kept having issues with her heart, kept having to go to the hospital, and it would be very serious every time. And every time it would scare the living daylights out of the security guard. And every time she would come back the same day. And it was clear and evident that there were things going on with her heart. Ultimately, they decided they were going to give her open heart surgery. And I told her, we need to advocate that you go to recuperative care when, you get out, because by the time you get out of surgery, the shelter's going to be closed. And, a shelter can't take care of people with that kind of need. That's best for recuperative care. So the hospital would call me and tell me, okay, we're going to send her back tonight. She got out of surgery this morning. And I would have to advocate no, because there's not going to be anywhere for her to go. And they would say, she's healthy enough for discharge. I'd say she needs a recuperative care bed. And this just went on and on. We even looked into private paying for recuperative care for her, which came out to $1,700 a day. And that was on the cheap end. Some of you in the room know. So ultimately, we did get her into recuperative care, but we had to pretty much babysit the situation and make sure that they didn't discharge her without doing that. And I want to say, too, for the healthcare workers, absolutely, the stress that is endured and the compassion fatigue is so real. And so I do think that if we were to increase home ownership amongst all these incredible frontline staff that you heard from today, not only would they be able to participate in a future, shared housing operator like the one mentioned earlier, but they would also know how to call and be prepared for that emergency response. So I'm asking you guys to understand the importance of all of the domino effects that delayed surgeries and people exiting the hospital after surgery onto the streets can cause. But let's really be creative also moving forward. Thank you.
Thank you. Now hear from the next caller.
Thank you, Honorable Supervisors. My name is Lee Friedman. I'm the Senior Manager for Strategic Partnerships at San Diego Community Power. SDCP would like to add its voice in support of Item 14, the Evergreen Fund Framework, which, if approved, would invest $14 million to create a matching flex fund and green job small business fund. Growing our local green economy is central to the mission of SDCP, and access to funding is a critical component of building an innovative and competitive green economy. Thank you again for your time today and for your continued investment in our local green economy.
Thank you. We'll now hear from the next caller.
Hi, my name is Matthew Roberts. I wanted to take time today to express my full support for the expansion of recuperative care bed capacity in our community. I'm a volunteer at Interfaith Community Services in various capacities, and I've witnessed firsthand the impact that these programs have on preventing individuals from being discharged in the streets and facilitating their transition to stable housing. On a personal level, I think what's really struck me is how much these beautiful, the people I've met have that I've gotten to know are really just like me, and I frankly, myself or many of us here could very easily be in their shoes, right? High cost of living, et cetera. So I don't know. The experience has also helped transform my general kind of position of impersonal passive pity or something like that to one of like active loving compassion. I'm not a behavioral health expert. I'm not a public policy or fiscal policy person or politically savvy at all. I'm not frankly qualified to speak on much of anything, but what I can share is my experience, right? And that's been that I've seen firsthand, like the sense of optimism and hope expressed on these patients, that I've gotten to meet, which was only possible by having these services available to them and to help them transform transition to self-sufficiency. So this proposal, I think, is a vital step in addressing the urgent crisis of homelessness in our region. It provides a cost-effective, high-impact solution, a part of the solution, right, and improving our overall well-being for our community members. I urge support, and thank you for your time.
Thank you. Now hear from the next caller.
Christina Salder.
Please go ahead.
Oh, thank you. Thank you, Chair and Board of Supervisors, for proposing the solution. My name is Christina Salder. I'm speaking on behalf of Serving Seniors as the Director of Community Engagement and Government Relations. I'm happy to offer our strong support for item 14 to provide medically vulnerable homeless individuals with safe spaces to recover. Our region has a terrific opportunity here to expand services and capacity for unsheltered older adults experiencing medical episodes where recovery care is critical to their dignity, safety, and well-being. As fellow providers have shared here today, it's heartbreaking to try to support our unsheltered clients who wait patiently and often in severe discomfort for necessary surgery and or medical attention with the current resources that are available. This proposal implemented will allow us as a county to do much better than offering a return to the street or a temporary stay in a motel isolated from the physical and emotional support that they need. Using the proposed funding in this strategic and humane way will speak volumes to San Diego's unsheltered older adults that we see them and that we care about their health, safety, and quality of life. We urge you to vote yes on item 14. Thank you.
Thank you. Now hear from the next caller.
Hello?
Yes, please go ahead.
Oh, thank you so much. Hi, thank you to Chair Vargas and supervisors for the opportunity to speak and share perspective on this board letter. And thank you also to the many San Diegans who have showed up in person to share their personal experiences. I think it was said before, but really appreciate and honor your vulnerability and bravery. My name is Erin Hogeboom. I'm Director of San Diego for Every Child, an initiative committed to cutting the experience of child poverty across our San Diego communities. I want to begin by thanking the board for your stewardship of the ARPA funding our county received from the federal government, from addressing pressing immediate needs that arose at the outset of the pandemic in fields like child and health care, to having the foresight in thinking long-term with regard to this Evergreen Fund. San Diego County has really served as an example for other regional governments in intentional and impactful investment. And thank you also to Supervisor Lawson-Remer and the team for putting forward a proposal to your colleagues in the public. I'm really encouraged to see how this will honor the spirit of thoughtful and wise investment as our collective expertise can help to continually craft this proposal. I want to commend prioritizing mental and behavioral health in the form of supporting and expanding the workforce that is currently striving to address this pressing need across our county. Even more specifically, I really want to encourage that a significant amount of these workforce dollars go towards supporting and expanding workforce equipped to address the needs specifically of children and youth. Hardly a day goes by that I don't hear about the pressing child and youth mental health crisis that's facing our communities and this country. The special additional training that's required to serve youth and children and their families calls for additional investment. You know, our children and youth are not currently invested in proportional to their population, and that has to change if we care at all about prevention and the long-term health of our communities and region. So for that reason, I really want to strongly encourage that you as a board prioritize support and expansion of child and youth behavioral health workforce investments in this proposal. Thank you.
Thank you. Now hear from the next caller.
My name's Margaret Decker. I'm calling from Escondido in support of item 14. I serve as a volunteer chaplain with Interfaith Community Services, so I wanted to speak a bit about the vital place that recuperative care plays in response to homelessness. I work both with the general homeless population and with the recuperative care population. And I will tell you that recuperative care makes a major difference because it keeps people from going back to the hospital. In the past, people would go to the hospital, be released, go back to the hospital, be released, go back, and the shelter in the street is no place to recover. The other thing that recuperative care offers is case management. And so while it gives people a place of stability, it also gives them a way to access resources and find a way to secure permanent housing. That time in recuperative care is vital both for healing, physical and mental, but also for gathering the resources, finding out how to get housing, and getting and securing housing. I've seen it work. It is working now, and so I urge you to support item 14. Thank you.
Thank you. We'll now hear from the next caller.
Good afternoon, Board of Supervisors. My name is Jarrell Howard, a proud SEIU Local 221 member, 10 years, employee of San Diego County, HHSA. I am in support of the item 14 for all programs that could help. And here to ask you to look at the budget on this, to ask you to look at the budget for this Evergreen Fund to support all county workers with the increase of health care costs. Kaiser increase for 2024 was 14.5%. That is 9.5% more than the standard amount of 5% we plan and budget for each year. Many workers do not receive a salary raise yearly, but the cost of health care, shelter, utilities, food, gas, family needs, etc. keep going up. We have county workers that work 40 hours a week and are unsheltered. Many workers are leaving San Diego because it is the most expensive place to live. We have many vacancies that we need to fill with workers. We cannot keep good workers or hire and keep the new workers as well as because of the cost of living here. Please approve item 14 and consider a stipend for this year to help workers to recover from the extra amount coming out of our paychecks each pay period, and to increase the flex amount for 2025 to help pay for the health insurance increase that we will receive. So workers can stop worrying about how they can keep working for the county, the job they love, and continue to live here in the city that they love. Thank you.
Thank you. We'll now hear from the next caller.
Truth, no more script readers. First question, is anyone working at Edgemoor today, or are they all at this meeting?
The subcommittee waited until Monica's arrival to bring back a report of the framework for item 14, but she's only been here for less than a month. Is that really enough time to make a well-informed decision? Program 1 is proof that those currently running the county don't care about our critical infrastructure or Americans. Joel, one of your fellow Republicans, didn't like the $1 million a month toward illegal immigration, but they didn't even know about that $6 million going towards the shelters, but I made sure to tell them, don't worry. Program 2 sounded good until the deception known as harm reintroduction was included at $8 million. Program 3 is another $8 million deception when it uses the word care, when it's really about throwing homeless people into cheaper, lower-grade facilities as part of the state's conservatorship agenda to force people into their useless programs while simultaneously taking control of their possessions. Program 4, expanding the behavioral health beast and doubling the size of county government at the cost of $24 million to be scrapped. We currently have people in government with behavioral health issues that haven't even been addressed yet. Program 5, wellness payments are a form of fraud. They're bonuses masquerading as health care payments. If you guys really cared about real health or worker retention, y'all wouldn't have demanded that county workers get the deadly clot shot or they'd be fired. Program 6 focuses on so-called affordable housing for the county workforce at $25 million, while non-government workers continue to struggle. That's inequity. And Program 7, decarbonization means mining unsustainable lithium, emitting toxic fumes, combusting into fires that can't be put out, and with infrastructure and batteries that can't be recycled. So much for climate justice. A real bold vision would be to finally reject what's never worked. Item 13. The only people benefiting from the fee waivers for ADUs are big corporate developers. If anyone really cares about housing availability, waive every single fee to build a single-family home. But you know what? I'm going to put up a few tents in my backyard and rent them out for $200 a month for each unit. Now that's affordable housing. If tents are good enough for the city of San Diego to use as shelters, then it must be good enough to rent out. And plus, we're all going to end up in tents soon enough at this rate of government interference. That's the real housing crisis. And item 12. The American Ruination Plan Act was supposedly implemented to rescue America. How many people have been rescued by the debt that's been accumulated? How many people have been rescued by their businesses and lives locked down? Better yet, how many have been rescued by the deadly cloud shots sold as a cure for immortality and normalcy? What normalcy? When there's millions of debt dollars printed at the expense of every American living and to be born into the future to the benefit of purple shirt beggars who say more money will stop them from snapping at patients. Wrong. Money won't help your behavioral health issues. Quit. And the other benefiter was politicians who no longer had restrictions on their budgets. This county received over $650 million to play with, and all they had to do was say yes to everything the state and federal governments demanded. Of course, they sold out, and we saw things like the community enhancement and neighborhood reinvestment budgets skyrocket from $700,000 a year to over $11 million, all while homelessness increased by 22%. Fraudulent organizations and political criminals were also propped up. The Cannabis Cardenas grassroots loaned $40,000 to Nora's campaign, with another almost $5,000 from Jesus' other fraud, TMC Direct, for printing campaign mailers. Will she have to pay back the last $17,000 if they're behind bars? And will they have had that money without PPP loans? Nope. Yet we only have 2 fall guys for an entire network of political benefiters from ARPA-based fraud. That's why this entire program needs to finally end. There's no point in discussing the benefits of shuffling money derived from fraud. I've already seen the worst uses of this debt in Chula Vista and here at the county, and I've even seen the best uses in other cities with the building of fire stations. But when the country finally crumbles economically because of the ARPA funds, what purpose will even the good projects serve? And what did any of it?
Thank you. Chairwoman Vargas, that concludes public comment on this item.
First and foremost, I want to say thank you to the team for all of their thoroughness in this process. I think as it was been mentioned in the particular presentation, right, $655 million were allocated from ARPA, and it was specific to save lives, get people back to work, support their need during a very, very challenging time. And so as a board, we created an ARPA framework that we agreed on, the previous board did, and of that, 67 million is what we have on the ARPA component, and 66.6 million is what we have on the Evergreen Fund. My colleagues, so at the last At the last board meeting, we talked about when we had the economic outcome, we talked about making sure that we asked for this particular session, number one, because we do have a new colleague, and number two, because you all asked for specific direction about how we move forward with the Evergreen funds. And so on item 12, the board letter specifically asked for, receiving the update the report, and then also number two is developing recommendations to revise the ARPA framework based on the projected remaining ARPA funds, and then returning to the board with recommendations on how we do that. And I think it's really important, that all of you are asking for clear direction about how to formulate some of these recommendations and what that looks like. And I want to say I appreciate both Michael and Ebony being very clear about sort of reminding everybody how we got here, because I think that's very important, right? We had a fiscal subcommittee that was created back in 2021 that really focused on the intent of that subcommittee was really to review and assess and recommend modifications to the county fiscal policy. That was the actual ultimate goal that we directed them to do as a board. And then the fiscal subcommittee started meeting, and one of the things that they also took into consideration was recommendations for the Evergreen, and those were going to be recommendations to this board to move forward. There was a memo that was created in April 28th, right, 2023, that provided broad priority recommendations, and then the committee sunsetted back in March of 31st of 2023. So I think it's important to mention this because I want to make sure that we are all following sort of the timeline of how we got to where we are right now. And when we had the economic update in December, it was very important, and to me, that we really look at, we talked about the financial outlook for the county, and we also talked about the possibility of a $400 million budget gap for the next 5 years, and I think that's important to emphasize. And so the recommendations before us from staff is really, I think, very thoughtful in leveraging all of the resources and really thinking about how we remain consistent with prior board decisions. And so it really, we don't want to backfill all our budget with ARPA funds, right? And there are direct needs related to ARPA programs that can be addressed simply by using these funds over a period that it seems to me like a practical resolution to be able to do that. But as it relates to the Evergreen Fund, one of the things is that Evergreen funds, the way that they are intended to function is not necessarily how we have been using that Evergreen Fund, right? We did talk about it being a fund that we were going to use for long-lasting impacts or to be able to leverage additional funding. Those are the conversations that we had as a board about what the Evergreen Fund was. And I know Ebony already talked about it in her presentation, but I think it's important to mention that because while the name Evergreen might imply a fund that is more like an endowment concept, we knew, or in a self-replenishing fund, that was not how it was supposed to be operationalized in the county. However, we did talk about making sure that it was long-lasting impacts and able to leverage additional funding. All of this is important as we're moving forward and making decisions because to date, the Evergreen Fund, what we've done is we really have used it as an emergency fund to address some of these challenges and emerging situations and priorities. And you can argue that that's what ARPA funding was for, but separate from that, I think we have to be very clear. And so a lot has changed since the last couple of years on our board. We have a new supervisor, the economic variables are different, and priorities have changed, and also many new laws that are impacting us directly about some of the needs that we have as a county as well are impacting us. And so so that's one component, right, with item 12. And then we have colleagues who introduced two items number 13 and 14. And those two items that my colleagues brought forth are investing funds in priorities like housing, behavioral health, and to support our county workforce. If we support those two items, the Evergreen Fund is gone. So I think that's important to note, right? Right now, at this moment, with no real sort of discussion or direction, which is what we were supposed to do today, really provide a framework and then come back and say, okay, these are the things that we want to look at and create themes so that we are really impacting the region and really looking at the funding from that lens. And so I want to make sure that I emphasize that I'm strongly committed to voting for something that is reflective of the current needs that we're incorporating into our overall priorities. And I do believe that this is the part where our colleagues should have a conversation about what those priorities look like and really thinking about what the economic outcome is going to be and how do we make those connections, I think is critical. So far, the Evergreen Fund, we've been able to use it on behavioral health issues, housing issues, climate change, economic prosperity, homelessness. I mean, we've done a lot of different things with that Evergreen Fund. And so I want to make sure that we are able to have that conversation today and that we really think about long-term sustainability impact and really what is it that we're trying to accomplish, or is it we're going to piecemeal things and create Band-Aids for some of the biggest challenges that we're facing as a county. And so what I would like to ask my colleagues to do is that we provide input on how we use the Evergreen funds and the recommendation, which is what we had the conversation before during the last session, is to make sure that we provide the interim CEO by January 22nd with feedback so that the board can come back on February 27th with recommendations on the remaining balances and how do we actually include actions to implement those options that are presented by staff. So there's the ARPA piece and then the Evergreen Fund. And I think that the board has a very unique opportunity to really guide the remaining Evergreen funds for lasting investments and looking at some of those recommendations and what they are versus very focused on, let's do this piece here or that piece there, right? So I want us to really be thoughtful in how we approach the investment of our ARPA funding to the point that really it has played a big role in the region's health and economic recovery, so we can do more. And in addition to that, I think we need to provide staff with specific recommendations that we're moving forward. So I'm going to go ahead and make a motion to support staff recommendations, which is 12, 1, and 2, right? And that include the proposal on how the program to remain the ARPA framework balance of the $67 million. And my understanding, based on the conversations that I've had with Ebony, is that, do you want to just kind of acknowledge that piece of the funding for the $67 million, whether we use the ARPA funding or not, those are all items that we already have committed to, correct?
Thank you, Chairwoman Vargas, for that question. The items that we have identified as candidates for the $67 million are items that are inclusive in the ARPA framework or related to the ARPA framework. The only other item that's there that is a little bit of a set aside is the $10 million for FEMA, which is associated with the congregate sheltering, which we believe is at risk for reimbursement.
Okay, thank you. And so, so then what I would like to be able to do, like I said, ARPA framework balance of $67 million, and then return to the board on February 27th with recommendations for the remaining balance of the Evergreen Fund. And as part of the motion, I would like to direct the interim CEO to include priorities from all board members when developing proposals on how the program remaining funds for the Evergreen Fund to be considered when the interim CEO returns to the board on February 27th with the Evergreen Fund recommendations. Again, this is up for discussion, but I think based on what I've heard, my colleagues have talked about behavioral health, climate change, economic prosperity, homelessness, workforce, and so I think it's important for the CAO, this interim CAO, create a memo via the board members no later than January 22nd, so that the CAO can return to the board with the Evergreen options on February 27th. One addition to this, though, is that I'm asking my colleagues that specifically on item number 14, that we pull number 5, and that we actually make a motion, that part of the motion includes supporting our county workforce well-being and hiring and retention goals by investing in a one-time payments on wellness to our employees as outlined on item 14. Because I do think that, to the point that was made earlier today, we give a lot of we highlight a lot of the work that our colleagues are doing, but I think it's important to also support them financially with this motion, and so to include that as part of the motion. And then the rest of the items continue on, items 13 and 14 in the Fund Control District number 1, so that we can be considered when the interim CAO returns to the board on February 27 with the Evergreen Fund recommendations. So to be clear, if we support the item number 14.5, the new number will be, what is it, 50, I put it somewhere in here. 53.6 is what will be left in the Evergreen Fund. So I think it's important to note that as my colleagues are thinking about supporting or not supporting this item. So Vice Chair Lawson-Remer.
Thank you so much, and I'm very happy we have the opportunity to have this really important discussion. I think as the chair pointed out, we have really a moment here to make transformative investments in our community to really make a lasting impact, and those moments don't come very often. So I think this is a really important conversation. So I have a lot to say. Obviously, there's 3 items on discussion. So I'm going to take it kind of in 3 parts. I think there's the process question, like in other words, do we move forward with anything today, nothing today? Do we come back with a report back on February 22nd? So there's that sort of a process question of do we do something, nothing, or everything today? And I think that's a really important conversation because I think we have some really incredibly urgent needs, but I'm gonna bracket that and circle back at the end of my remarks. I think there's the second piece, which was county staff brought forward a really thoughtful report in item 12 in the ARPA framework, which identifies how much funding we have left and asks for specific directions from this board on how to utilize that remaining funding. So I want to talk about that. And then third, of course, I want to talk about the Evergreen Fund, and has been noted here. We had a fiscal subcommittee, and we were charged with coming back to the board with a full report back. And unfortunately, due to circumstances beyond the control of everyone here, that report back was not made because we did not have a full board at the time. So I have tried to fulfill my duties as assigned and circle back as the last woman standing on that fiscal subcommittee with that report back now that we have a District 4 supervisor. And again, acknowledging that in that Evergreen framework that I brought, that there's a lot of work of county staff that I want to make sure has an opportunity to be shared out to my fellow board members, because I've had the privilege of being in those conversations, but not everyone has. So this is going to be a little bit lengthy. There's kind of 3 pieces, but so bracketing the process piece, just talking beginning with the ARPA framework. You know, this is for my board members' benefit, but frankly, really for county staff. I think you guys asked for direction and just sharing my thoughts. I think you did a great job on attachment C. I think overall it's very much in alignment with what this board has previously supported. I'm not pleased about the 10 million change for FEMA, but you can't do anything about that. And I think that's where kind of hands are tied. So I think that's wise. The programs that really stuck out to me that I want to make sure are definitely included when you come back in a few weeks is the specialized funding for imminent needs, the 1 million, which is the homeless diversion prevention flex funding. The shallow rent subsidy bridge program, which is again ensuring that our seniors that have been part of our shallow rent subsidy program don't fall off a cliff. The employee child care benefit program, I think that's really important for our county workers. The $3 million for the innovation in foster care cash transfer program, and the 1.5 for tenant legal services. So these are all things you already mentioned. I just want to uplift that those are strongly in alignment with my priorities. I do have a question that I'd like you all to be able to answer when you come back for a vote. Because in attachment C proposes 3 homeless shelter programs to provide emergency shelter to homeless individuals immediately. And those programs total $33.5 million. 8.6 is for emergency shelter solutions, 15 million for RHAP motel vouchers, and 10 million for RHAP and vouchers. Again, the first was 24-25, the second was 25-26. So That's all great. I don't have a problem per se or in theory. We absolutely need to prioritize homeless solutions to prevent and end homelessness and get people reconnected to stable housing. I think what I need is some more data. I really need some data to better assess whether these programs are the best way to use the resources. And given the size of the expenditures are $33 million, I think I need to see a table of the different options to support preventing and ending homelessness. So what I'm envisioning is a basic comparison of different ways we can do emergency housing solutions. We definitely have the RHAP motel vouchers as outlined here. We definitely have the emergency shelter solutions as outlined here. But there might be other ideas. I know my colleague who's not with us right now has mentioned, safe parking before. Sprung Shelters has been part of the conversation. I really want to know kind of very specifically, what are the one-time capital costs? What are the ongoing costs? What are the number of people served annually? And what is our anticipated cost per person per night? A very simple, not some complicated impact analysis, literally like a cost table, because right now I think we're all in alignment that these emergency shelter solutions are really important, but I think I'm at a little bit of a loss of the data to know which of the potential avenues that we could pursue in terms of emergency shelter solutions is going to be the most efficient use of resources and be able to serve the most people. So that's the table that I would love to see. And we'll share this with you all in a memo. I want to kind of move to Evergreen, but let me just pause there and see if our team has any questions about my ARPA comments on the 67.
It is very clear, Vice Chair. Thank you.
What's that?
It's very clear. Thank you.
It's my goal, trying to be, you asked for clear direction, we're working on clear direction. Great. So then I just want to pivot now to talk about all the pieces in the Evergreen report back. And as mentioned, we had an interim memo that was circulated, and what's included in this report back expands on and tries to provide more details and put meat on the bones of what was in that initial memo that was produced in response to board direction as these being the priorities. And that being said, there have been other needs that have emerged in the meantime, particularly around county worker wellness that were not included in that original memo. So I think it's about 90% in alignment with that original interim memo, and then there's been a little bit of new items as well. So, I think very big picture frame, I appreciate the work that our entire board has done over the past 3 years to make huge investments in behavioral health and homelessness and plugging some of these infrastructure gaps. I think this has been a priority of the board, and the kind of intent of at least my work on the fiscal subcommittee was to try to honor those priorities and put some meat on the bones of what we could really do in a thoughtful way. Particularly looking at options that would be, frankly, as my colleague pointed out, right? Really, Chairwoman Vargas, I think hit the nail on the head. She said, we're trying to find the things that are evergreen, right? That are not going to just spend the money, but are going to be able to be either leverage additional resources or renew itself, or the other ways in which we're taking a little bit of money and turning it to significantly more resources for our county. So I think it would probably be helpful, especially for my colleagues, I'd love to be able to ask county staff a couple questions about some of these items, because I think you all can explain better than I can, what's in them and how they would be structured to be able to kind of meet that vision of the Evergreen Fund of being able to draw down additional resources. So I'm going to go through each one item by item. So just beginning with recuperative care, I think this is something we're all probably pretty familiar with after listening to all the testimony. This is the item where the proposal is to put $8 million on the front end, which would be the capital cost, but be able to draw down ongoing operation and maintenance to really pay for the operation of a recuperative care center for many, many years in the future without impacting county dollars. And I know the estimate that Greg Engel gave us was that it would be about $35 million over 5 years. So $8 million could turn into $35 million in order to better meet the acute medical needs of people who are unhoused in our community. But I think, I feel like Dr. McDonald is probably, or Amy actually, maybe both of you, are probably better equipped to explain how the recent changes to Medi-Cal and Cal-AIM have created this new opportunity to leverage the managed care plan to pay for recuperative care, not out of the county's coffers.
Yes, well, thank you for that question, Vice Chair. Recuperative care is one of the 14 community supports that what was formerly known as Cal-AIM, that is now known as Medi-Cal Transformation, there's been a name change, has asked our managed care plans, is actually to support overall wellness for individuals. Our local healthcare plans have all committed to providing those services locally, and that includes recuperative care, which I think you heard defined very nicely by folks. But I do want to point out that it's not just used by individuals who are homeless. It's people who are at risk for homelessness, people who are living alone, who wouldn't be able to sustain themselves in that environment without support, not at the level of a skilled nursing facility. People can come not just from hospitals, but from skilled nursing facilities, actually from jail or from home, because they're getting ready for a medical procedure, as some of our speakers actually mentioned. So this is a service that is provided and can be billed to the Medi-Cal plans by recuperative care entities. In addition, there's short-term post-hospitalization housing, which actually can last a lot longer than the typical 30 to 90 days of the recuperative care that you've heard described here. But I thought they did a great job of describing that once you've set this system up, the system can be sustained with funding that comes from Medi-Cal and other sources, whether it's the VA or other health insurance. So it is an issue of increasing capacity and starting up these services so they can be sustained in the local community.
Thank you. I mean, I appreciate that. I think when we were meeting with staff, and this is really for my colleagues, when we were meeting with staff on these items, I think that's what really captured my attention, was the idea that we could invest a little bit on the front end and be able to draw down significant additional resources over time, which I felt like aligned with the idea of the Evergreen Fund, or the principle of the Evergreen Fund. So I can't take credit. I think the credit goes to county staff, but I'm glad we can bring it to the board for consideration. So thank you. I appreciate that. I want to talk about, I think it would be helpful. Let me actually move down to the bottom. Oh, sorry. I want to note that we had letters from UC San Diego Health and from SHARP in support of the recuperative care, in addition to all of our testifiers who came today. I want to skip down to the bottom, and then I'll kind of go through the other pieces. So green economy, and again, this, where's Steve? Steve here? Sir. Again, I feel like I get, I got to put my name on the board letter, but I get no credit for this idea whatsoever. I think Steve was a brilliant hire as the Deputy Director of Economic Development and Prosperity, and that was, appreciate Chairwoman Vargas's leadership in starting that department in the first place. So thank you, and bringing us Steve. So I just had a couple questions, because you educated me, and so now we can maybe educate everybody. If you could talk a little bit about the county's recently completed comprehensive economics development strategy to allow our local partners to now access federal EDA dollars.
Sure. Thank you, Supervisor. Again, my name is Steve Lockett, Deputy Director for Economic Development and Prosperity. So our county's comprehensive economic development strategy, or CEDS, was put into place in September of 2022. This is a 5-year strategy developed to promote the economic development goals and objectives of the entire County of San Diego for the next 5 years. This CEDS is required by the Federal Economic Development Administration in order to tap into EDA funding, whether we as the county go for that or our partners here inside the county boundaries go for the EDA money. This SEDS, while laying out 9 strategic goals that really define economic prosperity in a very broad manner for the county, allows us and our partners to really put forth initiatives and efforts that will promote economic prosperity for the entire community, raise the quality of life for everyone, and allow us to go for pots of money that we could not previously go for.
That's great. So can you talk a little bit about the challenges you heard from our stakeholders in finding local matching sources? Because I think this is what you brought to me and said, hey, we need some local money if we want to be able to compete for federal dollars.
Sure. One of the main issues that many municipalities, nonprofits, governments face when they go for federal funding opportunities is that many of these opportunities require a match, whether that's 10% up to 50%. A lot of EDA projects require up to 50% match for a grant, dependent on certain factors such as per capita income or annual certain issues that we can get into at a later date. This is oftentimes a barrier for many communities and many organizations that do not have a ready source of capital to put forward to that match requirement. For example, should there be a program under EDA that either us or a community could say is a $1 million project, EDA will require that they find a match of $500,000. This is a huge barrier to a lot of organizations, a lot of communities, and having a source that could maybe not provide the entire amount of this match, but maybe serve as the last dollars in to make sure that this grant could be funded and applied for would be incredibly beneficial, and is something that I've heard from many of our partners.
I appreciate that. I think that's also the reason that I thought this was such a great idea when you proposed it, Steve, and I appreciate the opportunity to bring it to my colleagues as well for consideration. As I, again, thought it was really in alignment with the intent and vision of the Evergreen Fund, that we take a little bit of our money and we turn it into a lot more resources for our community, and that if we could have, a few $1 million that we could put forward, we could bring in tens of millions of additional, even maybe hundreds of millions of additional state and federal dollars, particularly in the context of the Inflation Reduction Act and the pretty significant funding being made available by the federal government that right now we are not in a position to win because we just don't have the resources. So I thought that was brilliant. I'm glad you could share that with my colleagues and that they could, have the opportunity to consider this a green economy proposal. Any other thoughts that you think would be relevant for folks to kind of think through as we think about this today?
These are topics that have come up in the year and a half that I've been here with the county. And I can say that the county is seen as a real leader and convener in economic development opportunities. And I know certainly we've heard today on the call, Jason Anderson from Clean Tech calling in. There are many of our partners in communities, whether they're nonprofits, whether they're municipalities in the county, who look to us as a county as that leader and convener in many of these opportunities. And they're just very grateful that we are at the table and willing to work with partners all across the county.
Thank you. Thank you very much. Appreciate it. Is Luke here? Sir. Luke. I promise I won't ask as many questions as last time.
Hi, I'm Luke. Happy to be here.
Hi. So behavioral health workforce, obviously you are beating a drum every single day about the importance of our behavioral health investments. I thought it would, you've said to me many times how important it is that we invest in expanding our behavioral health workforce and that there's, we're on track to be about 18,000 workers short. I think it would just be helpful if you could talk about some of the key findings of the behavioral health workforce study and from the workforce partnership and staffing bottlenecks and how you envision this kind of fund or evergreen portion of the behavioral health workforce investments tackling those staffing challenges.
Yeah. So where I think more resources would be helpful, as informed by the report that was produced, is in, I would say, sort of 3 domains or dimensions. One is in a pipeline, in kind of doing everything possible to ensure that there's many people moving into a pipeline towards, involvement as a behavioral health professional. So things that have been talked about are things like tuition reimbursement programs, that sort of thing. A second domain is retention. So it's often challenging for people, even who are, have long-standing careers in behavioral health, to stay in behavioral health work. Just sort of given challenges in the economy generally. So retention is a second important consideration. And the third is diversity in the workforce. We know that kind of identity and senses of common identification are actually really important to outcomes for people who are in the midst of behavioral health care. And so anything that we can do to increase diversity in the workforce and the diversity of providers across the county who are doing public behavioral health work or work that's driven by Medi-Cal is important.
The other question I wanted to make sure we had time to discuss was how this aligns or does not, I guess, because that's the question I've been getting, with the MHSA training, the already approved program, because, of course, we don't want to be duplicative. So I think it would be helpful to better understand your thinking on how these fit together, or is there any duplication?
Right. So you're referencing innovations funding from MHSA that we've gotten approved through the MHS OAC, the Oversight and Accountability Commission. I generally see, opportunities to complement the funding that would support that work. We anticipate that work touching around 3,000 people. The number that has been mentioned numerous times here is between 18 and 19,000 plus. So there is a lot of additional needs still. Also, I would say that work generally is oriented around pipeline. Less around retention, and so there are opportunities to complement it, I think, with an emphasis on retention.
And again, going back to the chairman's comment and point, right, that we're really looking at these being transformative investments for our region, not just money like we spend one time. How do you see investments in training, not just being, okay, money we've spent? How does this actually transform the structure of the labor supply and demand of the behavioral health workforce?
Yeah, I think a good place to consider that dynamic is around efforts to diversify the workforce and diversify categories of providers in particular. One of the things that we know is that in particular small providers of behavioral health care in communities of color tend to disproportionately not be certified to do Medi-Cal work. So a lot of the work that they do is either self-pay or funded through philanthropic gift. Opportunities that we would have to support efforts to have those smaller providers serving these communities disproportionately in need become Medi-Cal certified and thereby sustainable is an opportunity, I think, to increase care where it's most needed and also to create settings to engender a more diverse workforce over time.
Thank you. Anything you'd like to add? You've talked my ear off on this item, so anything you'd like to add now that you have the floor?
No.
Okay. Thank you.
Thanks.
Appreciate it, Dr. Berger.
So Supervisor Larson-Numer? No, you're good. You're good. Thank you. So Vice Chair, so I just want to make sure that I think it's, I understand what you're going through each of these items on item 14, right? Absolutely important, and I think none of us would argue that none of these items are important and are critical, or that there are opportunities for us where it could actually meet some of the Evergreen recommendations. The reason why I'm asking, and I'll let you go back and continue to, because I understand what you're doing, right? You want to be able to explain each one. But I want to make sure that it's clear that no one is opposed to one or all of them or anything like that. At least I'm not. And the intent of my motion is not to say that none of them are priorities, and I understand that we can make an argument for all of them. But I think part of the discussion that we wanted to have today was we have a new supervisor. We have a lot of things that have happened since the recommendations about what the Evergreen Fund was. And I want us to be able to have each of us the opportunity to come back, right? Which was the intent of the conversation that we had in December, that everybody was going to come back, and then we were going to have a framework discussion today, the Evergreen Fund, how we wanted to spend it, and then we come back and create memos, and then together decide, okay, what are the priorities based on the 5 of us together? I think you sort of already wrote your letter of what you think.
No, those are not my priorities. Those are the fiscal subcommittee's priorities, but if certainly I will, I mean, other priorities I would include.
Yeah, so I think, and I don't know, I saw the memo, I'm not sure that those were necessarily the same, but that's not the argument, I don't want to have, that's not the discussion. I think what I want to make sure is that it's very clear that, you know, all of these and a whole bunch of other items could be part of the Evergreen Fund, and they could be items that we can find an opportunity to leverage that support, financial support, et cetera, et cetera. But what the intent of my motion is really so that each one of my colleagues is going to, you know, we create a framework, and then each of the colleagues, including yourself, of course, and Supervisor Anderson, who unfortunately had to leave for illness reasons, have an opportunity to come back, provide a memo, and then we have a discussion and we prioritize, all right, like we've done before. Remember when we had like the housing, you know, the housing initiative where we had an item where we decided, okay, this
I want to say I
is
agree that we have to have a process conversation. I said in the beginning I wanted to bracket that, go through the substance and circle back to process. So if you wouldn't mind if we could finish the substance and then we could circle back to process. I said in the beginning I had 3 parts. Process,
no, I understand.
Item 12,
but
and
I
item
just
14,
want to make sure.
And we're on item 14. So if we can get through the substance, then we can circle back to the process conversation. Thank you. So the next item, the next piece of this was the county workforce housing, and this was $7.6 million. So again, I think there's a lot of questions. I have to say that this is a piece that I think there continues to be a lot of questions about, and I would love for David Estrella, are you here, sir? I've gotten a lot of questions. I think it's still not super clear, and I think it would have to be kind of better specified and clarified through a lot of conversations with other board members and county staff, et cetera. But it would be helpful to hear from you. What do you envision?
Good afternoon, Supervisor. I think the first part of the discussion would likely be a county council question and an HR question, so I'll defer to Claudia to start with.
In regards to the workforce housing, we would need to look at what kind of programs could be supported under current existing law. So for example, under the Fair Employment and Housing Act and structured like that, what other options for development could be considered, as well as meet and confer.
Thank you. David, anything else you could talk about how you would go about identifying potential sites or potential opportunities to partner with philanthropy?
So big moving parts would be, of course, you know, identifying the broader parameters as to number of units. Well, maybe not even number of units, but really just the individuals that would be assisted. Kind of a broad brush idea of, you know, the scope and size that we're looking for. Definitely working with Department of General Services, as we would with other excess land, identifying an existing property or identifying a site generally around, we would assume, workforce hubs or along transportation corridors to meet the needs of the workforce. And then, you know, creating an RFP, a request for proposal, releasing that proposal, and evaluating the sustainability and effectiveness and long-term financial viability of a proposal. And then ultimately, you know, that developer, once selected, would identify other funding sources and leverage other funding sources as appropriate, depending on the situation, maybe tax credits, or in other cases, definitely consideration of leveraging philanthropic resources, which is something that is always an important component that I think the county has made every effort to expand. Similar efforts like the San Diego Foundation's Affordable Housing Development Fund that they have been working on over now the past couple of years, and it's a stated partnership between the county and the San Diego Foundation to create 10,000 units on excess municipal land across the region. So that would generally be the path of development. Of course, the primary consideration is first fair housing considerations, the legal component that would go along with identifying housing specific to staff, and that's definitely in the realm of human resources, county council, taking those first, making that first analysis and what's viable with state law, and then the housing and financing component would come second after that.
Thank you. Anything else you'd like to add?
No, thank you very much.
Thank you so much. And then I think the final piece was the wellness funds. I think we had really moving testimony from our county workers of why those have been included. And, I think enough has been said on that front. So I think moving on, I just wanted to make sure that kind of the work of county staff and had an opportunity to be shared with my fellow board members as we kind of consider what to move forward. I think from my point of view on process, I know my colleague has made a motion. I think I would prefer an alternative process. I do agree that we definitely need a report back where we can consider a framework on the second meeting of February. I think that's great. I strongly approve and agree that. I think it would be helpful to provide clear direction to county staff as they go into that regarding what of the items that have been already considered by this board today that they want to that we would want to see included for consideration in that framework. So, I think there's, my colleague Supervisor Desmond has a proposal for $16 million for ADUs, and then there's 5 other proposals in the fiscal subcommittee. And I think my preference would be go item by item and say, I think we could, there's sort of 3 possibilities. One is we vote to move on it today, which is what Supervisor Vargas proposed regarding the $13 million in wellness funds. That would be option 1. Option 2 is we like it. We think it's a good idea for consideration to be included in the framework in the end of February when staff comes back. We're not going to act on it today, but we conceptually like it, and we want this idea to be concluded for consideration as part of a broader package, which I think is I read as the intent of my colleague's proposal. And then the third is there any items that we're just like, no, we don't want to see this included for consideration when the board reports back. And so my preference would be, I think we will end up with, frankly, most of these items coming back. I think that's probably reading this room where we'll end up. I think that would provide but some greater clarity, like if there's anything like the wellness funds that we think need to be acted on urgently, we could move. If there's anything that we don't like, 3 of us don't like, we could say, don't include this, so we're not asking staff to run up, barking up the wrong tree and working on things that don't have board support. And if there's items that we're like, look, we think this is mostly in the right direction, we like this concept, we want this included, please include it, then at least staff knows that this should be part of the options that come back. So I guess, I don't know if that's a motion, but that would be my proposal, to go item by item to be able to give staff clear direction for each item.
Thank you, Madam Chair. Appreciate it. And I understand the motion. I guess it's bring everything back as originally planned, but you also then picked 14.5 to be approved today as part of that motion. Okay. Well, I would like to, there's 3 items here, and I had speaking points on all of them, and so I would like to address my item as well. But one of the things I will say on the ARPA framework, and I think the main thing that we really need to emphasize for the Evergreen funds is these are one-time dollars. And I think they should be utilized on one-time investments that benefit us all in the long run. And I've heard that from my colleagues as well. And I think it should be like the purchase of properties, capital improvements, mental health facilities, supportive housing, and recuperative care beds. That's what we're lacking. We are lacking supportive housing, even if we get somebody into a facility or into recuperative care. Where do they go after that? So I think we really should make one-time investments actually in supportive housing or transitional type housing with these dollars as an investment going in the future. We know we got a huge mental health crisis, and we're going to need ongoing needs for facilities. And I know workforce has been mentioned, and I support the workforce or bringing on more workforce, but we also need the facilities to do that. So, and also we got SB 43. We're going to be January 1. We gave 12 months extension on SB 43. So we're going to need to find and have facilities readily available. I'm looking at a site up in North County. It's like over a 50-acre site that could be potential for healing, supportive housing, recuperative care, all sorts of needs. And it would cost money to buy that. And I do think if we invest in land or potential sites now, and even if we don't use them, we can sell them later. When I was the mayor of San Marcos, we used to, we knew population was growing, and so we'd buy land for fire stations, we'd buy land for parks, we'd buy land for other things that we thought were coming down the pipeline. And so if you wait to buy them, it's going to cost a heck of a lot more later. And if you want to sell them, you can do that. But I really think we need the infrastructure to be in place for the recuperative care, for the recuperative beds and supportive housing and those types of facilities, because we are lacking those. And with SB 43, the state gave us a tool to get people into care, but then we don't have the housing or facilities for them. I'll talk briefly on the ADU, item 13. I understand you're passing this over in your motion, but for the past 5 years, we've been running a successful fee waiver program for accessory dwelling units, and it ends today. And what's happened is the county has waived fees on roughly 1,500 ADUs, resulting in about $15 million in cumulative savings to people building an ADU on their property. So it's about 10 grand per unit. 10 years ago, we had less than 50 ADUs being built a year in San Diego County. For the last 3 years, we've built almost 400 a year. And a lot of people that are occupying these ADUs are senior family members, and that, can move in. I think it's a lot we discussed, as far as sharing rooms or bedrooms or things like that. It's a lot easier to rent out your ADU than it is to have somebody in your house sharing a bedroom with you. But, so I do think by eliminating this financial barrier and carrying on this fee waiving of the ADUs, what's happened, our ADUs have predominantly counted towards our low and very low income categories under our RENA. 55% of the ADUs have been built qualify for low and very low towards our RENA numbers. For very low, we're required to build 1,834 units of very low units in San Diego County by, I think, 2028. As of our last count, we only built 190, but 77 of those were ADUs. For our low, we were required to build 992 units. At our last count, we've built 526, so we're halfway there, but 25% of those were ADUs. And so this is especially, I think it's a lot easier. This is the low-hanging fruit, I think, for more housing. It's costly to us. It's the permitting process. We're losing money because we're waiving that fee, but we're getting a lot more housing built, particularly in that low and very low. So I had asked in my board letter that we extend this for another 5 years, and I know it costs about $16 million. Even if this was brought back and it went another 2 years, that'd be about $6 or $7 million. If it was brought back and we can extend it, just so, okay, here's your last chance for potentially providing ADUs, and like I said, it's primarily for seniors. So, and then with that, with the Evergreen Fund, I'm sorry, item 14, let's see, where am I? Yep, 14, okay. On 14, I appreciate the fact that you're bringing back, or just pulling item 5 out of there. One of the things that I noticed on item 14, and I will 100% support, is the recuperative care homeless beds. I think most of our speakers all said we need more and more of these things. And I think that my thing with it is it wasn't enough. Only $8 million out of, now there's, out of the $66 million that was proposed to be spent in item 14, only 8 of it was going to recuperative care. I think we should be putting more money towards the recuperative care, more money towards housing and supportive housing and getting that infrastructure in place. So I'd ask the maker of the motion, even though I don't think anybody's seconded it yet, that you add item 3 also. If you're going to put item 5 in there, 13 million, I'm pretty sure the staff's going to come back with recuperative care. And if we just put the 8 million in there right now, and actually I'd like to see more. So I would ask the maker of the motion to include item 3 in your motion to include the 8 million for this recuperative care in item 14.
So let me ask you a question on this, and
Sure.
I'm happy to consider it, but I want to make sure that it's really clear, and I think it actually was mentioned by some of the hospital folks who actually shared this, because I think there's some misinformation about SB 43 and also recuperative care. Those are 2 separate things, and I think it's important to to be able to talk about it that way, because everybody keeps bringing up the fact that implementation for SB 43 has to happen by January 1st, 2025. And so the reason why I'm asking for the team to come back, because what I would like to be able to see, and I'm not saying I'm opposed to recuperative health beds. I want to make sure that I'm clear about that. But if we have specific needs related to the implementation of SB 43 that have to take place as of, that we've agreed to take place as of January 2025, my interest would be that the behavioral health team come back in this recommendation, as when they come back and they say to us, out of all these things, this is where you can actually put some money that would actually help address this particular issue on SB 43. And maybe that's not what we want to do, but I want to make sure we're not combining it because it's not the same thing. And just so that it says, right, I mean, here it says, SHARP fully supports investment in the County of San Diego's expansion for recuperative care capacity in the region. We all can agree on that. It says, however, the need for additional recuperative care beds is not related due to the implementation of Senate Bill 43 and the association expansion of the gravely disabled definition. So I want to make sure that that's clear because we're not comparing apples to apples. And so it's important that we have that conversation because otherwise we're going to go out of here and I say, okay, let's take it on, $8 million for recuperative care. But do not get confused that that's going to be able to address the issue of SB 43. So I want to make sure, and if I'm incorrect, I want to make sure that staff is able to share that with me.
No, I think that is absolutely correct. I mean, SB 43 involves care that is involuntary, and recuperative care is not an environment to care for involuntary treatment patients, period.
Thank you, Dr. McDonald.
But I do think it's important that we move forward with that. You still got $45 million left.
I got it.
If you do that.
I'm happy I accept your second as long as we're clear on what we're accepting, because I do think that we have to come back in each of our memos and really think about, what does this look like as we're moving forward. To me, it seems, I think it's important for us to identify how we get this work done. But again, the whole conversation about this is that we don't want to do,
piecemeal.
Yeah.
But I think recuperative care is probably the safest bet out of this to include and get it moving forward and I think kind of show our commitment to it.
All right, I'm happy to accept the second.
Then I'll make the second then with that caveat that include item 3 and 5.
Okay.
14.
Got it.
Thank you.
Supervisor Montgomery, accept.
Thank you very much. So I will, my notes and everything are all over the place, just FYI for everybody. I'm not going to be as organized as my colleagues have been. So for item number 12 and attachment A, that kind of goes through the expenditures, remaining balance, there are a few things that stuck out to me. One is under mental health services, the support that we provide for children and youth. I hear across many different communities that this is a major issue. There aren't many details here as to what that support and help looked like. So provided that we do have a deep dive of a discussion at the end of February, and I would like to have more details about what that looks like, because for me to make a decision and provide more feedback, what has been successful, what has not been successful. I know what I hear that the needs are, but I don't know that what we are currently allocating that money to is meeting the needs as I know them to be without having those details. So I would like more information about that. In addition, always a concern seeing us, that we have to spend down the $44 million under emergency housing. Happy to if you have any response to that what the process is currently, because again, if we want to have true feedback, we need to know what are the possibilities of us spending down this money in a timely manner, also considering the lost revenue strategy.
Sure, thank you, Supervisor, and I'll make just a couple quick comments. So the mental health investment you're referencing is our screening to care investment set up under ARPA, universal screening for middle school students. I think we're working with about 40 schools now. And so we can certainly come back with more data on our report back about the number of youth served to date and the types of interventions
What
they're
is
connected
screening to care?
You want to tell them, Dr. Luke?
Dr. Bergman.
Yeah, the month in, this is what I'm saying.
It's my baby. Go ahead, sir.
Okay.
So just very quickly, this is meant to be a universal behavioral health risk screening for youth in school. We're starting in middle schools, and Amy is exactly right, about 40 of them thus far. So the idea is to do a risk stratifying screening of all kids, rather than waiting for the impacts of behavioral health crisis to be evident to school staff. We are proactively screening and then navigating through a tier 2 set of tier 2 service providers that we've got regionally distributed across the county, navigating kids into care depending on the level of risk.
Supervisor Montgomery stepped to note that there's still some work that needs to be done, because in some school districts they opted for opt-ins, others opt-out. So I think there's some work that the county can do in terms of the reach of that program, because it's actually an excellent program, number one. And then number two, we created the Promotora program around that as well, so that we can actually ensure that parent education is included in that component, because mental health stigma is such a reality, particularly in communities of color and the BIPOC communities, and so we wanted to make sure that that was a big component of that. And so it is a wonderful program that I think still is being.
That's right. It is in a relatively developmental stage with lots of opportunity for continued growth.
Okay, just last question on this. Since it's in a developmental stage and we see that there could be an estimated remaining balance of $19.39 million, are we able to expand the program and develop it appropriately to spend down that amount?
Do you want to speak to that?
Yes, thank you, Dr. Bergman. So great question. The remaining balance there just reflects the ramp up that it took to engage the schools and get them to work with us. And so as Luke described, we're continually ramping up. What we propose as the staff recommendation on attachment C is certainly screening to care is one of the programs that would be ongoing. And so we would use some of that $19 million to continue to fund it in fiscal year 25-26, and then use also some of that $19 million to help some of those other areas that were also going to be ongoing. And then I know Dr. Bergman is also, him and his team are working on sustainable funding sources for screening to care as well, and there are some good opportunities there for that one.
Okay, thank you. The emergency housing? Thank you, Dr. Bergman.
Yes. So for the emergency housing, what our balance remaining that's projected at the end of 24-25 assumes is that the county will stand up 5 emergency sheltering sites, among the options of safe parking, sleeping cabins, RV sites. To date, the board has approved 2. So of the 5, there are still 3 that are going through the due diligence stage. Our HSAC Housing and Homeless Support and Equitable Communities Department works very closely with the Department of General Services. For those 3 remaining sites that are in the due diligence phase, staff would come back for final board approval and authority on any go, no-go decisions there. So if we did not go forward with all 5 sites, then that balance would increase.
Okay. And again, we're being asked to build out a framework, right? So we in order to make the most informed decision, we should know the probability of what we have planned, it actually coming to fruition with this funding. I would like to see that as close as possible as you can get to it when we come back and are reviewing this. Okay, on the last thing that came to mind on this general conversation for me was about food assistance. It's still here. Folks are still in need of meals daily. in my district, we are experiencing nutrition insecurity at 28% compared to the countywide benchmark of 24%. 39% of children in the district experience nutrition insecurity compared to 30% of the county. And so as a part of coming back, I want to, as this is zero, well, the majority of it is zeroed out, or there's really not much of a remaining balance, just making sure that the impacts of the pandemic with regard to food assistance, we are looking at that very closely. Also just, there may be some educational component, particularly for County District 4 residents. We are at a lower threshold of participation in CalFresh, even though our need is higher. And so I would like to dig into that a little bit more too as we make these decisions. So for reporting back in February, I was under the impression that, and I appreciate Supervisor Lawson-Remer going through some of the details just for my reference, because again, it's been a month. And that really helped me to understand like what next steps may be. Because my understanding that potentially we would choose things on these lists and these items that have been brought forward by my colleagues, and then maybe come back with a little bit more program design in detail. I don't think that that's the case, right? I think it would still just be a larger conversation about framework. So, okay, because I think that's where the board is going, but I do think that, you know, that we have another conversation about framework. We need to put some time certain on that to make sure that whatever we do decide is moving forward in a timely manner, because a lot of these things are still require that urgency. So that, you know, I won't include that in my direction for the February meeting. But I would like more detail about the screening program for our young people, and also this one, career pathways for foster youth, some of the results that we've seen in our investment there that we have used ARPA funding for. So before I just briefly get into 13 and 14, those items, I do want to point out that, you know, within the backup documentation, the Evergreen Fund is defined, and it's defined as a fund that would leverage ARPA resources to draw down matching funds, philanthropic donations, and other funding sources that might provide a self-sustaining revenue stream. My understanding is that the actual fund has not legally been set up as a self-sustaining revenue stream. I would ask council to address that piece of it. Would there be additional work to be done to actually achieve what the original goal was?
If the board's direction is to establish a self-sustaining fund, then we would need to take appropriate subsequent actions to form that for that purposes. That would require some potential accounting and also potentially some partnering if that's how we're going to do that. But we have not received final direction as to the programs and whether or not they're going to be self-sustaining in that regard. So we would await that direction from the board.
Okay. Oh, well, it looked like that was the original goal. So if the board wants to abandon that, that's fine, but it looks like if that was the original goal, then there needs to be additional legal analysis around that.
Correct. Yes, that's correct.
So at least maybe we have some analysis around what we would need to do to make it that self-sustaining revenue stream that was originally the vision of it before we abandon that.
But let me have Ebony, go ahead.
Yes, if I may, thank you so much, Chairwoman Vargas and Supervisor Monica Montgomery-Stepp. We will definitely spend some more time talking about the program. I appreciate that you know, you've spent some time with us, but we've got a lot of catching up to do. So just wanted to offer that to you as well. In relation to the Evergreen Fund structure itself, a fund could be set up as an accounting mechanism to capture the resources and to you know, to allocate revenues through the budget process. It will really be determined based on the actual type of investment that is made, on whether or not that's appropriate from an accounting perspective. At this point, the items that we have discussed, we haven't necessarily got there in that complete analysis. There could be an opportunity for something along those natures, such as the Clean Tech Energy Fund, for example. But it may be that we have funds for specific items, but not all items. It will really depend on the nature of the items that are ultimately selected, but that will definitely be something that we will consider.
Okay, thank you for that additional context. I was just kind of listening to the comments, but also going back to what the board letter said, and it's a little, just for me, refocusing back to what was this, since I was not here when it was originally decided. I can only go by what is here before me. So, okay, well, to conclude that conversation, I guess we need to figure out what the framework will be and then determine if there's another accounting mechanism that we need to use or a legal structure that we need to have to make the fund self-sustaining. Okay. On 13, certainly understand the importance of ADUs. I don't think that we should subsidize this program right now with this particular funding source. So I want to make sure I make that clear about generally understanding, the importance of this type of ADUs, but a fee waiver program when we are talking about having to make decisions for the future, possibly experiencing deficit at the state. All of these things, I just want to be laser focused on one of the most important issues is that our most vulnerable communities are truly suffering. And unless there are conditions tied to this fee waiver program, coming out of this fund, I don't think that I can get there with regard to support for it. And then on 14, yes, agree that certainly the urgency, all of it is urgent, but I think the action that we can take on number 5 is more readily available for us. Like, we can move on that very quickly, whereas some of the others require a bit more analysis and working among county staff and also folks that are already doing this work that we have heard so much from today. And I also appreciate the distinction with the beds, the recuperative care beds, because I was also thinking as a part of the SB 43 conversation. So if it is not, then that's we still need them, but we thank you for making that distinction for me, because I was thinking that as a part of that conversation we need to take whatever opportunity we can to build out that infrastructure for what will be the implementation of SB 43. I also just want to say, with regard to the public behavioral health workforce issues, this is something that I know that the county has been working on. When the study was commissioned, I have read the study. I understand that this is extremely important, so I would like to prioritize that as well. From what is here before me now, I don't know exactly what next steps would be if we were to approve this today. That's my only hesitation. I don't know if Supervisor Lasser-Reamer has any ideas about what that would be, since it was in your board letter, but.
I'm happy to answer that. We would clearly need another board letter to specify and outline what that program would look like. I think we could direct county staff to do that. We could direct county staff to do that in consultation with all the board offices, or we could direct county staff to do that in consultation with, a few board offices that have a particular interest. But we would certainly could not move forward on this program. This is just would be broad parameters and saying, hey, this is what we want to use the money for, but we would obviously need further board direction to clarify exactly what that program design would look like.
Okay, so if we move forward with the, Helen, did you want to say something?
I just want to make sure she's clear on which one you're talking about.
I'm talking about number 4. I'm talking about number 4 in the item number 14. And so Okay, so then, based on my feedback and the deadline that if this motion passes, that will be January 22nd, I will include ideas for a framework around that after going back and meeting with folks that I think already have some programs set up that we can benefit from, Dr. Bergman, of course, and getting a briefing from him. And so that's the way that I will approach it. But for me, I'm prioritizing that. So as direction to staff, I would like to prioritize increasing our workforce, whatever that looks like. Okay, thank you very much.
Yeah, and I heard loud and clear prioritizing building out infrastructure to meet the behavioral health care needs as another one from my colleagues as well. Vice Chair?
Yeah, I just want to say I want to kind of convey to county staff, as I said to my colleague, I was trying to be a good shepherd of the fiscal subcommittee, but I would not think of all of these as my priorities. So as you kind of think about frameworks to come together, to come back on the second meeting of February, I think I'm with my colleague Montgomery Stepp, that the behavioral health workforce seems like such an urgent priority, and I think building on best practice models and kind of as we were thinking in regards to the proposals outlined in this, and happy to continue to talk with the team about how to build that out. I'm sure my colleagues will have thoughts as well, but I will certainly continue to think with you about what the specifics of that program could look like, and that will be a huge priority. I think I have some concerns. I think, again, I feel like just echoing Supervisor Montgomery Stepp's comments on the ADU program, I would just want to make sure that these funds are really being used to advance issues that help our most vulnerable members of our community. And so I'm not at all clear that the ADU program to date has who it's benefited. So I think if we're gonna, I'm not really very inclined to support it, but open to more data. And I think what I'd love to see come back would be, some really kind of just cursory information. What's the average housing price of the individuals who've been able to take advantage of this permit program? I think that's important. What's the cost of the units that are being rented, right? So are we really providing affordable housing? And then I think it's also important to identify whether we're making a difference in accelerating ADU construction, because I know that the ADUs have been accelerating across California at about 300% more ADUs now than previously, and that's without any kind of subsidy. So I would just say, I think, as my colleague said, in terms of sharing kind of general thoughts with the team, big picture, I think behavioral health, workforce, the programs that we've outlined here, super important. Unlikely to get there on ADU, but open to a conversation with data. And I think the other piece that I think pops for me as something I really is really appreciative of Steve's thoughtfulness around the green economy investments that would allow us to draw down more state and federal funding to be able to make our limited number of county dollars go a lot farther. So just as you kind of put together frameworks, I think two of the things my colleague already voiced, and then just adding a third.
Thank you. I want to make sure that staff is clear and that we're clear on exactly what the direction is. So thank you for that. We understand now where your priorities are for us to come back with. So if I understand the motion, it is taking item 3, the 8 million, and then item 5, the 13 million out of the Evergreen fund, and that, Ebony, check my math, leaves 45.6 million. Yes?
That's correct.
And that's what we would be coming back with?
That's
based on your feedback here. So that's one thing I wanted to say. The other thing is, if you proceed in pulling out the item 5, the 13 million, we're going to need to meet with you all to get directions for labor negotiators, because there's a variety of ways you can implement a program like this, and we need to just make sure we understand what those parameters are, because we will be negotiating with each of our labor unions
And you're going to be leaving in 20 minutes.
As we move forward. So that's why I just want to make sure
Where's Sarah?
She's gonna work overtime today.
We know what the bogey is. We know the 13 million, but does everybody get it? Is it just ones that had a discrepancy between what the benefit amount was and what the increase had been? Because some actually didn't have an impact. Others had a bigger impact. So there's some details like that we would need to flesh out. And so I would recommend, council, that we do that in our normal closed session where we get directions to labor negotiators, and then that we give that direction to DHR and labor relations to go work with all the unions on how we would implement that. And then we would be prepared to bring that back in a recommendation and then a comp ordinance change.
Just real quick, I just wanted to reiterate on the ADUs. Over half of them, 55% of them, went to either low or very low towards our RENA numbers. And on the very low side, we are way behind. And we had 77 ADUs went towards the very low. So there is some good stuff coming out. Thanks.
Thank you. So we have a motion and a second, and I want to say again, thank you to the team. Thank you to everyone who put so much work on this. The ARPA framework, the ARPA funding was created to help support folks during a very, very difficult time. So as we're looking at, the board letters that will be, the memos that we're going to be recommending to the team, and as the team is putting together recommendations, the long-term investment of this $45.6 million is absolutely critical, but the more we can do to make sure that folks who are on the brink, right, which is our biggest role as county supervisors, is to make sure that we are that safety net for so many. If we're able to really maximize those dollars to support that people don't end up on the streets, that they have access to food, that they have access to the basic needs that we've all been fighting for so long, to me, that's a top priority, and that's what you're going to see in my board memo as well. So with that, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors who are present voting aye.
Thank you. So the next item on the agenda, thank you very much for your work. The next item on the agenda is item number 15, the resolution amending the rules of procedures for the San Diego County Board of Supervisors. I'm going to have Supervisor Vice Chair Lawson introduce this item, and then we're going to go ahead and have public comment.
Thank you so much. I appreciate it. I think I'm probably going to turn it over mostly to Claudia to speak, but I think the last 3 years we've seen increasing disruption in our meetings, and we've had some incidences where the entire event didn't happen because of people who really came and made it impossible for the public to participate in a meaningful way, and made this environment really hostile for the broader public to exercise their rights to free speech and participate in public discourse. So apologies. I don't think there's a lot kind of specified here, but the intent is really how do we kind of have some choices and options. And apologies, Chair, I'm really tired, so if I'm doing a bad job introducing this item, yeah.
Thank you, Vice Chair. Based on the recommendations by yourself, what we would do is look at the various legal options to address disruptive behavior within the context of what's the allowable boundaries under the First Amendment and also the right to assembly. Look at innovative approaches so that we balance the people's ability to participate appropriately and fully in the process of appearing before the Board of Supervisors. With the other part of that, which is how to allow the meetings to proceed orderly without the disruptive behavior continuing on and ongoing. So that is a balance that we're taking a deep legal dive into, and then we would report back to the board in the appropriate form with the legal analysis within the time frame specified in here.
Okay. All right, public comment?
Thank you, Chairwoman Vargas. We have 22 requests to speak on this item, 9 in person and 13 requesting to speak by phone. Also note for the record that we received 2 e-comments, 1 in favor, 1 in opposition. Any members of the public that requested to speak on item 15 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with the speaker in favor, followed by those in opposition. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'll be calling you in groups of 5, so please listen for your name. I'd like to invite forward the speaker in favor, John Brady, followed by the speakers in opposition, Pam, Michael Brando, Oliver Twist, Gambler, and Audra. If I've called your name, please come forward. Ask you to please state your name for the audio record, and you'll have 2 minutes to address the board. You can come forward in any order. Do you want the person in favor first? Just come forward in any order. Yep.
Pam, no on 15. The First Amendment to the U.S. Constitution prevents the government from making laws that abridge the freedom of speech. Abridge is the restriction or curtailing of speech. Tyranny is the arbitrary or unrestrained exercise of power. In this item, under refining public participation rules, it is recommended the County Council will be directed to explore options for those who engage in a pattern and practice of disruptive behavior. Are you making a list and naming names? Will these individuals be physically taken down by the deputies as in the past? This proposed limit on freedom of speech by looking to punish the public aims to suppress opposing viewpoints and silence the people who recognize some policies of this board are harmful. The direction to the County Council reveals you're a weak, scared, intimidated, flustered. Yes, the Brown Act permits reasonable speech time to be determined by the governing body, but that time should not restrict or curtail speech. Freedom of speech is a principle that supports the freedom to articulate opinions and ideas without fear of retaliation, censorship, or legal sanction. This entire item appears as a threat of retaliation to those who speak out against the board, targeting a small group of individuals who are here every meeting in person or by phone, who have done their homework and challenged the absurd actions taken by some members of this board. This item also states some individuals no longer participate because of intimidation and harassment experienced when participating in person. I agree, the gaveling and sicking of deputies on public speakers can be intimidating. This item also references a healthy Democrat institution. The agenda and behavior with the gavel is very unhealthy. I'm perfectly healthy standing here speaking, as is my First Amendment right. And by the way, Planned Parenthood should rightfully always be booed. They kill unborn babies. This agenda item reveals cowardice and perhaps tyrannical behavior in anyone who votes in favor to limit freedom of speech and to target individuals. Sticks and stones may break my bones, but words will never hurt me.
Next speaker, please.
Hi, good morning, or now afternoon, board. Oliver Twist here, champion of free speech and purveyor in the marketplace of ideas. I do want to give a gentle reminder about the organizational chart, that it is we the people that are on top. And as one of the 3.3 million here, I'm here to against this item to let you know that this is unacceptable, that you continue to ratchet down our First Amendment rights, and especially Chairwoman Vargas at Sandag with the 1 minute, which was then emulated by MTS, and now you want to bring it to the BOS. I colloquially will call it the Sandag 60, the MTS minute, and now it'll be the BOS BS if you go through with this. You, especially that had advocated before and for people that you found marginalized, you have now become what you used to protest. And I don't see how you don't recognize that. The double standard of allowing clapping for the things of your choosing and then telling us when we speak that we can't clap or that our speech is not worthy of it, that is not equal treatment. And so I'm asking you to please stop the double standard and have rules that are applicable to everybody. Your own document says that clapping is, quote, conveys approval. I'm now asking for a friendly amendment to allow responsive clapping for public comment. You should not hold the public to a different standard than you do yourselves. Please lead with integrity. Thank you so much.
Thank you. Next speaker, please.
Michael, my comments will follow because this is related to this topic.
But I take offense
I take offense to that. I really take offense to that. I don't know what political games people want to play around this stuff. I don't care. I find that very offensive.
I didn't say the things you said I said.
I heard you say,
but it's not what was said.
Nobody's going to
listen to what they're saying.
You said corruption. Corruption and illegal is the same thing.
Chair, could I please respond to that?
Did somebody do something illegal? Can you tell me that right now?
I don't think this is illegal.
Yes, it is, because you just made.
I didn't say illegal, I said unethical.
You said it was.
Well, that was more from Sandag. Why is that related to this? Because we know what this item is all about. It's about censorship. How dare you, Tara Lawson-Remer, talk about the last 3 years and saying that people are disorderly? The only people that have been disrupting the orderly conduct of business, especially since Nathan Fletcher left, has been Nora Vargas. And she is light years beyond inauthenticity compared to Nathan Fletcher, who anyone could see right through. This is all about pathological politics, CBS 8, pathological politics. It's from a magazine locally called San Diego Reader. You know, I like to end on a good point, because I don't care if you give people 10 seconds, 15 seconds. If you want to say, because I said the word cake, I'm off topic. It doesn't matter. The power belongs to us internally, and there's nothing you can do to stop that.
As the next speaker is coming forward, I'll call the remaining speakers in person, Paul the Bold, Mark, and Luke. If I've called your name, please come forward.
Okay, Paul the Bold, you know me, but anyway. If you are amending the calendar as well as the rules of procedure, you need to say so in the title of the agenda item. Government actions need to be in the sunlight, all of them. This item is virtually identical to the ones which were rejected previously. How many times must we put up with this kid stuff crap, which is obviously not working? And let me stress, obviously. Speakers are regularly disrespected, including those on boards and commissions, on the boards. A speaker on non-agenda was called off topic. This sort of thing was happening too often. Speakers seem to be intimidated, and the board's reputation for fairness diminished thereby. It's actually almost gone. I wonder how many positive ideas you have lost in the process. I'm disappointed that you are still limiting our speaking time on the consent calendar. Appointments, ordinances, and rules changes are not routine and deserve more speaking time. Some of the speech may be helpful. If you suddenly change the speaking time, speakers may not get their main point across and use unconventional means to do so, like rumor, newspaper, TV, or political protest. In November, I proposed that the board trust this board with regulating our own speeches. This, instead of further restrictions, is more likely to produce good results and is worth a 90-day experiment. I haven't heard back yet. Finally, there should be at least one regular and one land use meeting in November.
Thank you.
Thank you.
Speaker, please.
Hi, Luke. It's ludicrous that the chairperson has the discretion to limit each speaker to 1 minute or on non-agenda or agenda items, which effectively prohibits any reasonable criticism. 2 minutes is a bare minimum if the speaker is extremely concise. Furthermore, allowing 2 minutes to comment on the entire consent calendar is approximately 6 to 12 seconds per item, and effectively prohibits any reasonable criticism of said agenda items, which is against 954.3C of reasonable criticism of said agenda items, which, of the Brown Act. 4 to 5 minutes is a bare minimum if the speaker is extremely concise. Your proposal is indefensible hypocrisy, since no board member would permit their time to speak on any item to be limited to 1 minute. And in regard to not interrupting board meetings, on Tuesday, October 10th, 2023, PM session at 1 hour, 3 minutes, 30 seconds on the County of San Diego YouTube video, Nora Vargas interrupts Michael for being off topic during non-agenda public comment. Amazingly, no one on the board corrected her. At such time of total disregard for public and flagrant violation of the Brown Act, public interruption to correct the chair is not only prudent, but a citizen's duty. And many in attendance tried to inform Nora that we were speaking on non-agenda, during which being off topic is a non sequitur. Citizens are the final defenders of our Constitution, and such tyrannical overreach must be called out when our board or sheriff ignore the duties they swore an oath to uphold. The price of freedom is constant vigilance, and such a broad policy leaves these offenses completely unchecked. Whether unintentional or tyrannical, such unchecked power is unacceptable in a constitutional republic. The supervisors are morally bound to consider any immediate violation of a citizen observes. For this reason, our First Amendment is inalienable and cannot.
Thank you. Thank you. Your time is up. Thank you. Thank you. Next speaker, please.
How you doing? The Gambler here, once again, Justin Castro. I find it, how do you know the county is scared of you without the county telling you you're scared of you? By simple, completely trying to figure out rules to stop someone. I heard, apparently, last week before Nora changed it and had Tara say that I cannot talk about election-related items on every single topic. That's opinion right there, because you guys were elected. And I can't wait until you talk to your lawyer friends to see what you could do to me regarding that issue, because we're gonna test that theory out. I'm just letting you know that. I'm gonna go ahead and force your hand, Nora, to do something with you, to do something against me for talking about election items on every single topic. Every single time I show up here, until I get you guys to address my concerns. I've been asking for 3 years, and you've sent cops to prevent me from asking questions, escorting me off the premises for not doing anything, not even telling me I did anything wrong, just saying I'm not welcome on county property. The day that I said that we were moving closer to a civil war and a world war 3 years ago, you escorted me off the premises because you thought I was being hyperbolic. Look at us today. It's amazing how basically everything I said in those papers pretty much came through, with the exception of I don't know if you are a plant or not. But we probably don't have to worry about it anymore, because your decisions possibly got yourself fired, which I find that disappointing because I wanted to do it. But ironic.
Next speaker, please.
My person uses the name Audra. So Claudia, when your bar aggrieved on state and federal charges, will you continue doing this? Because you think this is a joke. And you think that the people have no way to make sure that their rights are upheld. That's the sad thing, is that you guys think that being up on a dais here gives you authority, and that you can sit here and want to change the behaviors of people when you took an oath, each and every one of you, to uphold the rights of the people. And you can't even look people in the eye when they say that, which is so sad, because it's like, if I take an oath, which I'm going to be doing soon for something that I'm going to be doing, I will make sure that I uphold that with every inch of my being. But you guys can sit there and look at yourself in the mirror knowing that you're obfuscating and abrogating your oath, going after the people for the protected rights. The Constitution doesn't give us our rights, nor do you. It is our Creator who gives us our rights. That is supposed to protect it. You're supposed to protect it. You are, all of you up there, because you took an oath to do it. And Joel, Jim, you can sit there and roll your eyes all you want, but you did. And how many times have you done that for no reason? Huh, Nora? How many times have you done that and it means nothing? And then you act like you can sit here and come after the people for a right that is protected. We're supposed to be able to come up here and redress our grievances. But if it doesn't coincide with what you think is going on, then you come against the people. You'll have them beat up, you'll have them arrested, you'll do whatever, right? Gaslight them like they're coming across and like, you're trying to destroy the county. You're the ones doing it. You just don't like being called out for it. So you want to come after the people for doing their obligation. They're the ones coming up and standing up for what's right. All of you are cowards, and you can't even do it. And you will face our Maker, and he will be so disappointed.
Thank you. Your time is up. Thank you. Thank you. Your time is up. Thank you. Final call for Mark. Not seeing any movement in the chamber. We'll now hear from those that requested to speak by phone. We'll start with our first caller.
I'm Barbara Gordon. As elected officials, your number one duty is to serve the people of San Diego County. Your job requires you to prioritize the needs of the county by being transparent and accessible that will help facilitate the public's understanding of how the county operates. Today's actions to modify the rules of procedure could limit the public's ability to engage with their elected officials. If time is the issue with public comment to complete the meeting within a reasonable time period, the board should consider limiting the number of proclamations, which takes up a considerable amount of time at the beginning of the meeting, as a way to manage the meeting duration. Another option would be, instead of the Tuesday and Wednesday sessions, legislative and land use sessions, respectively, it could spread the agenda items equally on each day to help manage the meeting time at a more equitable time. The public is entitled to and has the obligation to participate in shaping their county's future priorities, but the best way to accomplish that will be to have their voice heard at our board meeting. Thank you.
Thank you. Now hear from the next caller.
Kathleen Lippett here. I want to thank Tara Lawson for acknowledging the vital importance of public discourse, dissent, and critical debate, and further noting her number one duty is to serve the people of San Diego. However, those words are inconsistent with the resolution to amend rules of procedures that deprive the public of their ability to weigh in on agenda items, whether on consent or discussion. Prioritizing transparency and accessibility does improve the public understanding of county operating procedures and should ensure public participation in shaping future priorities. When that doesn't happen, robust public pushback should be expected. When the public's right to weigh in on policies that will impact their lives, you are going to get pushback. An earlier comment opposed controversial items of public interest placed on the consent calendar. Doing so does not serve the goals of transparency or accessibility. Item 2, to use grant money to develop a socially equitable cannabis program in the unincorporated area without their consent bypasses the voice of unincorporated community members who will be most impacted. The board should be aware of the failures and problems and unintended consequences of these programs. The very people who were said to be victimized by cannabis laws in the first place are found yet again on the losing end of what amounts to little more than an inappropriate power grab. Thank you for letting me speak.
Thank you. Now hear from the next caller.
Good evening. My name is Becky Rapp, and I too am concerned regarding the proposed resolution. Free speech is a critical part of our democracy. Any individual has the privilege of coming and speaking to this board, voicing their opinions, concerns, and giving statements. We have a great honor to be a part of a democracy, and with that, we take the chance of having conflicting points of view. Potential statements may not be well received, but that in no way should take away the right of any individual from speaking publicly. Limiting speaking time is not a solution or benefit to the public in their ability to participate. It makes it harder and more challenging. The staff report uses language to make you think these changes will create more equitable public engagement and promote free speech, facilitating good governance. But in reality, it only limits the public's right to participate. The staff report states misuse of the public comment portions of board meetings by some individuals and groups has been proposed as threatening our democracy. But the reality is that the true threat to our democracy is limiting the ability of the public to come and speak to this board. Thank you.
Thank you. Now hear from the next caller.
Hope Nelson, item 15. Supervisors, some background. I've been coming to Board of Supervisors meetings since 2008. I'm a retired layperson who works with a nonprofit. You might recognize that I usually show up at the Wednesday land use meeting since I usually address issues related to Palomar Airport. Most recently, because of a funny little nuance in how items are agendized, I've attended some Tuesday meetings. There is a huge difference between the Tuesday meetings and the Wednesday meetings. Wednesday meetings are typically orderly, efficient, and respectful, and everyone is heard without disruption. Tuesday meetings are the opposite. I'm one of those who avoid Tuesday meetings when I can due to the nature of the public participation. Here's my problem, and I agree with Supervisor Lawson-Remer. There should be respect for all citizens in the room who have come to voice their concerns. The same folks consistently taking up everyone's time and off topic is a waste for all of us. Then there are the personal attacks that you all, for some reason, are expected to suffer every Tuesday. Respectful language to say what needs to be said and can be accomplished without personal insult. But my biggest concern, if what we see every Tuesday at every Tuesday Board of Supervisors meeting is allowed to continue, who in the world will run for office? Who in the world needs the abuse? And of course, to those who are so offended by the current Board of Supervisors, there is an election in November. You should run for office. Sit on that dais and see how it goes. To the Board of Supervisors, as a county resident and concerned citizen, please make the required changes that allow everyone to be heard in a respectful, civil, and productive manner. I'm sure this can be done in a way so that no one loses their right to speak. Thank you for serving.
Thank you. We'll now hear from the next caller.
Hey, this is Sean Van Diver calling in from a resident of Claremont. First of all, I want to say thank you to the Board of Supervisors for agendizing this item. I agree that we must serve all of the people, and that when you all are doing things that the folks that voted you in disagree with, that you should expect robust public pushback. It's so hard to accomplish any sort of robust public pushback because the same 20 or 40 people show up to spout conspiracy theories about the Illuminati every Tuesday, as the last caller pointed out. And look, limiting the time for public comment wouldn't be required if those same 20, 40 people weren't showing up grandstanding every day of the week. I'm a working professional. I can't afford to go down and wait for 4 hours while folks spout nonsense into the ether, especially those personal attacks that the last caller mentioned. In particular, I think it's outrageous that folks think they can just be anonymous and expect all of you to face the threat that they spout at you. the personal attacks, the inciting of violence, while they get to be anonymous and your addresses are out there in the world. So I am quite grateful that you all are agendizing this item, and I hope that you will support it. And thank you all for your service to our county and our country. Public servants like you make sure that those tens of thousands of people that voted for each of you and are not showing up to complain can go about their daily work knowing that the county is in good hands. Thank you.
Thank you. We'll now hear from the next caller.
John Grady here, speaking as an individual, not for my agency. I created an agency to train people with lived experience of homelessness on how to speak and respectfully and effectively in front of the County Board of Supervisors. And when I started that work 5 years ago, it was an organized and meaningful contribution, at large, from everyone that participated. That has deteriorated. It has made it unpredictable for when an agenda item is going to come up. It has made it a challenge to get people to attend. Because of that unpredictability, it has even denied people the ability to speak. To those who are speaking without reason or cause, and I laugh at someone who says they've got reason, let me tell you something. You are burning not only the time of the Board of Supervisors, but a large part of the administration of this county, as well as the rest of us that are trying to get our voices heard in a logical and meaningful way. You waste all of our time, and there are 3.3 million people here in San Diego, and you do not deserve the amount of time that you're burning every time that you make us wait. Go speak effectively. Thank you.
Thank you. We'll now hear from the next caller.
Truth. That Speaker Van Diver wants to know people's addresses, and he does have money, funded by the Truman Security Project. Now, I want to know why Tara's name is on this item now instead of Nora's. Is the change because of my friends at CBS? Reducing speaking time at a time of record low speakers is proof that you guys can't hack public input. 60 seconds leaves no room for mistakes or real discussion. Being an expert at dealing with the Sandag 60 and the MTS minute, I know reasonable time isn't even defined, and I'm offended by that lack of transparency. There needs to be a procedure for when one of you are talking too long, Tara, and a procedure for when one of you make a mistake and interrupt a speaker who's actually on topic, Nora. And Nora, both times you cut speaking time to 60 seconds. Everyone spoke on every item, and we were here much longer than if you had never done that. It's time to abandon Nathan's old stale status quo failed methods that's creating unnecessary tensions within these meetings. This so-called marketplace of ideas, Tara, is being allowed to operate as freely just as your father's friend Jane Fonda witnessed in communist Vietnam. But since you seem to believe in the same disproven economic theories, it's no wonder this item says theory of free expression. Wake up. There's no theory on creator endowed rights. It's a fact. I want county council to explore options for reducing the threat to free speech posed by tyrannical supervisors who engage in a pattern and practice of disruptive behavior. Non-agenda is the most important item, as it's an equalizer to ensure a real level playing field where every single person in the county can address the topics important to them. To limit non-agenda in any way, whether by topic, volume, or time, is for public servants to strip their constituents and neighbors of their constitutional right to address their government. From Robert's Rules of Orders Revised, number 47, quote, "No motion is an order that conflicts with the laws of the nation or state, and if such a motion is adopted, it is null and void," end quote. Yet oaths mean nothing to turncoats. That's what we have learned today. Should be fired.
Thank you. We'll now hear from the next caller.
Hello, good evening. This is Ellen Nash. Can you hear me?
Yes, please go ahead.
Thank you. I'm calling because I have experienced and witnessed all of the vulgar, awful, disrespectful comments that are occurring by this group of individuals, and I find it insulting. I find it traumatic to sit in a meeting with all of this vulgarity going on. I had to get up and leave the meeting today because of it, and I'm asking for the Board of Supervisors to implement this policy so that, yes, we do acknowledge free speech. Yes, we do acknowledge, and I definitely support all of us residents having a voice. However, it is important that we respect one another. We're all humans. The Board of Supervisors are human beings, just like I am. And they deserve respect, and they deserve integrity, and they also deserve to create a safe space, which is what we elected them to do, so that all of our residents can also feel safe and heard at the same time. Thank you for bringing this up on the agenda. It needs to be discussed, particularly starting out at the beginning of the year. Let's learn to be civil. Let's learn to respect each other. And most of all, let's learn to love each other and agree to disagree when we have to. Thank you, and God bless.
Thank you. We'll now hear from the next caller.
Hello, this is Kelly McCormick. As a county resident who regularly watches board meetings to stay informed, I encourage transparency in this process. Non-agenda public comment allows concerned groups and individuals to exercise their right to free speech and to address the board in a public setting. It is important this right be preserved. Please consider cutting time only if there is an extremely long agenda, and then please consider 90 seconds rather than 1 minute. I would encourage all speakers to address the board and the public with respectful language and without name-calling and personal insults. At the very least, let's think about the example we're setting for others, including young people. My son has watched some of these meetings with me and has looked at me with shock at the things he was hearing from adults in a public meeting. An exchange of ideas is vital. Let's get back to that, the exchange of ideas, and stay focused on the matter at hand or the topic at hand, whatever that may be. Thank you.
Thank you. We'll now hear from the next caller.
Good evening, Board of Supervisors. This is Ann Riddle. I often attend Board of Supervisors meetings, and I relish the opportunity to share the concerns I have about the agenda item or things that I see in my social work and work on behalf of young people in public comment. I understand sort of the conundrum that you're looking at today. However, I deeply respect the right of people to speak. I understand that you're going to try, or you're recommending that county council explore options for those who engage in a pattern and practice of disruptive behavior. I appreciate what you're trying to accomplish, but I have to admit that this language concerns me. Censoring, and this borders on censoring, is of concern. As a parent, one thing that I've learned is to look at my own behavior and see if what I'm participating in could be changed to make it a calmer, kinder, wiser situation. And I'd just like to respectfully suggest that clumping all those proclamations in one meeting on Wednesday with already a heavy agenda creates a kind of tense atmosphere. Clustering so many consent items all at one time, I think, creates confusion and, again, sort of an intensity of thought that maybe contributes to disruptive speech. And I also wonder, in watching the city of San Diego, for example, when city council members respond, they haven't been timed. They're only allowed 5 minutes, and they have to ask the chair if they can speak longer. I wonder if there's an opportunity to time your responses so your time in looking at these things is also timed like it is here for the public. On the other hand, I really appreciate your efforts to make a safe space for all of us who want to participate in the Board of Supervisors, but I hope we do it in a way that doesn't look like censorship. Thank you.
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
All right. So, Vice Chair? Do you want to make a motion?
Thank you, Chair. I'll make a motion. Happy to make a motion.
Second, okay. Any additional discussion?
Thank you. I appreciate the supervisor bringing this forward, but I can't, I'm going to vote no on the changes. I think it's simpler, especially for the public, particularly on changing the time for the start time for the Wednesday meeting. I think it's simpler, especially for the whole public, for the public to keep the hearing times the same on Tuesdays and Wednesdays with so much emphasis on transparency. I think meeting start times should be consistent. I also understand that there are significant issues coming to the board this year on Wednesdays that we need, they're going to take a lot longer time. Many things, complicated, controversial items were held off last year, primarily to the vacancy of the 4th District. We have the housing blueprint coming forward. We have several housing projects coming forward, and those go long and are controversial. And as far as the changes, I guess, go, the chair already has, I think, the flexibility and authority to address issues in the hearings. I don't see any need for the changes, so I'm not going to be supporting the item and do not want to have 11 o'clock start time on Wednesdays.
All right, so I really appreciate Vice Chair Lawson-Remer, the intent of this letter, and I understand that, nobody understands better than I do, managing these board meetings and trying to make sure that there's civility and that our communities feel an opportunity to come and speak, and that they have, that they feel safe when they're here. It is truly, truly, to me, really, it breaks my heart that each of these meetings get worse and worse in terms of the way people are behaving. And I say that because, I served on the community college board for many, many years, and we had very contentious issues that we dealt with. As a matter of fact, our Southwestern College governing board meetings started at 5:30 in the evening. Sometimes they ended at 1 o'clock in the morning, 2 o'clock in the morning, depending on the amount of public speakers that we've had. But people will always be respectful. We agree to disagree, and I'm hoping that that's where we're going to go. I try to use the parameters of the different guidelines, the protocols that we've created to ensure that people understand. I appreciate people having differences of opinions with all of us. When we got elected, we absolutely have been, we understand that that is part of the role. I also understand that as a county, we represent 3.3 million people. In my district, District 1, I represent close to, 635,000 people. And I also understand that there's a small group of folks who are the ones that are disruptive, and they are also disruptive in other meetings. But having said that, for me, it's extremely important that we continue to use the guidelines that we have, to work as closely as we can to make sure that we make the changes necessary. And I'm not prepared to support that piece. And the other piece is changing the time of the meeting on Wednesdays. I know that there's a lot of reasons why this request has been made, and I want to make sure that everybody understands that for me, I value family, and for me, it's really important that we put our communities, our folks first. But when we approved our calendar last year, that created an opportunity for all of our county staff to be able to organize themselves and to really decide, sort of how do they address some of the challenges that they face in terms of being able to manage their schedules. And so for me, it's extremely important that we don't make these changes now. We had a proposal last year about one of the changes, and then the time has changed again. And so although I am extremely sensitive to some of the requests, at this time I'm not able to support. And so again, I appreciate the spirit of the board letter, but at this point I want to make sure that folks understand that I'm going to continue to do everything that I can as your chair to use the guidelines that we have created to manage, the engagement. And I want to make sure that I encourage those folks who are really interested in giving their opinions to please come to the Board of Supervisors. We'll do the best that we can so that your voices are heard, even though sometimes it gets a little bit difficult. So with that, we have a motion and a second, please.
I've called multiple times. You're lying right now. I'm sorry. You have ignored me every single time.
All right, sir, I'm going to ask you.
No, go ahead. I'll go ahead and leave. It's
Okay,
anyways.
wonderful. Have a nice evening. Thank you for being here.
Chairwoman Vargas, that motion fails due to a tie vote. Pursuant to the board's rules of procedure, the board may continue the item for consideration at a future meeting. If the board takes no further action to continue the item to a specific date, then the item will be placed on the agenda for the next regular meeting on January 23rd, 2024.
Thank you. All right, so the next item on our board committees, our committee reports. So before I ask my colleagues for any reports, provide brief updates or progress, sharing any important information, I just want to make sure that I use this time to share with folks. As you all know, today we have an interim acting CAO, I should call it, is the actual official title for Sarah Agassi. We continue with that process around the permanent CAO position. I want to make sure that folks understand where we're at. So that folks understand that this is a process that we are all very committed to. We hired a consultant, CPS HR consultant. I've shared some of this before, but I want to reiterate it. There's been an opportunity to hear from the public, to provide feedback and engage in the process. We also continue, as a board, we have agreed to capture all of the information that was gathered from community, from our previous consultant as well. So that information is being used as part of this process. A brochure outlining the CAO job description has also been posted in the CPS HR consultant website, and it's also going to be posted on our website. And so we have a timeline in place to fill the position permanently within the next couple of months, and it's expected time frame to fill the position by the middle of, we are making sure that we have all the next steps so that we are able to fill this position in a short amount of time. It will be a national extensive search. Every one of my colleagues has been engaged, including our newest member of the board, to ensure her feedback is included, and it was included in the brochure, but in the process of the type of CAO that we're looking for, and then also components of how we're going to make sure that there's public participation in this process as we continue to move forward. So that was my report, particularly to that. And then the other report is that we have, I just want to update, as you know, I'm chair of SANAG, and so one of the things that I wanted to share is that we have January 16th will be the official date for Colleen Clemenson to start as the acting CEO of SANAG as well. We have numerous issues that we're trying to address there. Our board meeting is on Friday. I'm looking forward to seeing so many of you there. And those are the two reports that I wanted to present. I don't know if my colleagues have any additional reports. Nope. Yes, ma'am.
Just real quick on NCTD. At our December meeting, we adopted a discretionary grant strategy for 2024. Of particular interest for the county is the double tracking and grade separation projects at the Buena Creek area were included. This aligns with the county's focus on Buena Creek. Maybe I don't know if Monica knows, but that is the county's only rail transit stop. It's up in my district, just outside of Vista, and it's identified as a county VMT efficient area. So funding of the public infrastructure projects is going to be key to unlocking housing potential at this transit station. Amen.
I want to be in order, so I'll just save my comments. I just wanted to say happy Martin Luther King Jr. Day to everyone. We will not be in session next week, but this is a time to recall what Martin Luther King Jr. stood for in the face of all of the ups and downs that we do have. He just a reminder that he was not as popular as we proclaimed him to be at the time of his death. because of what he stood for, and he stood for what was right. So I'm looking forward to being on the boards and committees that I've been appointed to today, but I didn't want to lose that opportunity to say Happy Martin Luther King Jr. Day to everyone and remind us that it's really a time of reflection. Thank you.
All right, with that, I am going to turn it over, and thank you for the reminder, I appreciate that. I'm going to go ahead and turn it over to non-agenda public comment, and I'm going to have Vice Chair Lawson-Weimer go ahead and take over for the rest of the meeting. I have to take a flight to Washington, D.C., so I will not be joining you tomorrow, but we'll be fighting for additional funding for all of us for a couple of different items. But before I do leave, I do want to just say one more time formally, thank you, Helen, for your exceptional work and for everything that you've done for all of us. We appreciate you. We're going to miss you, but I know that you leave us in good hands with the team that you have built and the great work that has been done. So with that, I appreciate it, and I'll turn it over to non-agenda public comment for taking over.
Thank you, Chairwoman Vargas. We have 15 remaining requests to speak on matters not listed on the agenda, 7 in person and 8 requesting to speak by phone. For those that requested to speak by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. I'm going to call the first 5 of you. As your name is called, please come forward. I'd like to invite Oliver Twist, Tana LaPule, Sandy McBrayer, Audra, and Paul Hankin. If I've called your name, please come forward. Again, you'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Thank you. Good evening. Oliver Twist here. First of all, I did want to say thank you to Helen for all her years of service, steadfast and honorable for this county. We really appreciate it. Also, I wanted to talk tonight about transparency and a New Year's wish list for best practices. I've made the suggestions before. I'm hoping you'll be open to them, especially now with your 5th member here. One is, again, for a clock on the wall. So there's an archival record of times for beginning and times when people leave and come. It's very hard to discern just from a meeting video, so a clock would be helpful. Also to record the times when people, I know as a planning group member, in our minutes, they record the times people arrive. I think it shouldn't be up to the public as a matter of transparency to dig through minutes to find that out. I think you should record it, find out, and also do an attendance tracker, just as you do for your employees. Again, it shouldn't be on the public to have to go through every single meeting minute like Lauren Mapp did for Lemon Grove to find out what the council person attended. Lastly, I'd like to talk about fiscal sustainability. I know that there's a lot of emphasis on sustainability. You put a statement in all your board letters, but I really don't see enough emphasis on what I call fiscal sustainability. And so I'm asking that you would go ahead and put that emphasis and the needs on it. And whenever you implement a new program or put a funding update, that you would also give a 1, 3, and 5-year projection. And recently, one of the needs-based analysis would be this migrant funding that was originally 3 months and then got extended, and there really seems to be no end in sight to that. So I'm asking for a long-term forecast if this is going to be something that is potentially as a border area that we're going to be stuck with. I want that included in a long-term forecast. So the looming $68 billion budget deficit is going to make things painful, and I appreciate the long-term consideration. Thank you.
Thank you. Next speaker, please.
Talofalava. My name is Tana LaPule, and I'm a Pacific Islander constituent here in the beautiful county of San Diego. I'm actually here. I want to first say thank you to the Board of Supervisors for the wonderful commitment and passion you have for your constituents, so thank you. I also want to thank the 20,000 plus employees of the county for their work. But I'm actually here to present a cultural proclamation. And that cultural proclamation is for our great leader, Helen Robbins Meyer. You're chief, and so I have some gifts here to present to you. Try to stay within my time limit. This is actually recycled from my own home. This was bestowed to me for my leadership and my commitment to my communities. I'm forwarding this and passing it on to you. It's a tapa cloth framed with the ship, what we call vaca, or the va'as, which is a canoe. And this is just the The top cloth is for the pounding of this into a tree trunk, into this soft cloth, and the many poundings that you've taken over your 20-plus years. The canoe is for the navigation and just helping to guide this beautiful county. So that's for you. That's the first gift.
Thank you.
The second one is the kukui nut laced with the tea leaves. The kukui nut in our culture was the candle and your ray of light to the county of San Diego. The tea leaves, over time, it gets strong and brown like me. Hopefully, with the time off, you'll get to turn brown too. So that's that. And the last one is just ula lau fala, which is worn by chiefs. And definitely as a CAO, you're definitely one of those folks. And I want to state that one proverb that's very fitting, I'm looking at my time down, is meaning the person up front, like our amazing Board of Supervisors, are no more important than those who are behind to help run the beautiful ideas from our Board of Supervisors. So with that, I want to say, Helen Robbins-Meyer, you're my chief forever. Thank you.
I'm not a chief anymore, though. It's after 5.
Yeah, after 5 never stopped you. My name is Sandy McBrayer, and I want to apologize to the board that I'm actually not here to address them. I am here to thank Helen. She has been a role model for so many, for so long. She has led with knowledge and with her heart every single day. Her integrity and her grit and her grace has lifted us all up. There have been so many times as my mentor, as my friend, as a role model, she has taught me to stand with strength, to do what is right for the people of this county, and to never give up and to never give in. And so I want to thank you, having the opportunity to work with you for 27 years. Standing here that first time, putting shoes on the table of every child who had committed suicide and homicide, and said no more. We will fight tirelessly. And so I appreciate everything you have done for 20,000 employees, but over 3 million residents. You have given up your life, your weekends, your nights, the calls in the middle of the night. You always answered for anyone and everyone. And so personally, I could not give up a moment to stand up and say thank you for lifting me up, for always treating all of us as partners, as part of the county team. You are my hero. Thank you.
As the next speaker is coming forward, I'd like to invite the remaining speakers in person, Luke and Caitlin Radigan.
Hi. If you don't know me, I'm Paula Bold. Abraham Lincoln and many others called for a government of the people, by the people, and for the people. Many government bodies continue to limit our free speech and cut down our speaking time. When we can express ourselves, the dialogue is often slanted, the checkboxes pre-selected. We do not have input into the San Diego CEO selection once finalists are chosen. We should. Limiting our speaking time, interrupting us, cutting off our last sentences is perpetuating the disrespect you want us to avoid. It is not conducive to an atmosphere of tolerance, and it is the opposite of government by the people. It is a type of intimidation and a disincentive to full participation. Workshops with people pushing government programs and limited response time, especially to lies and insult, is not of the people. Pre-selected answers are not a government of the people. Government has a big burden winning our trust back, especially after COVID. People know when they're being lied to and manipulated. No more $250,000 studies, please, or new bureaucracies. If you can't trust your own people, someone should resign or be fired. If we are off topic or not yet on topic, you should give us the benefit of the doubt and accept what facts or lessons you can learn. You should listen, be patient with us, and be honored to have our free advice. This is what a government of people is about.
Thank you. Next speaker, please.
A person uses the name Audra. Tara, I seriously wish you were chair because you're so fantastic at not paying attention. I feel like we could get away with pretty much anything in here. Maybe we should redo that vote. I don't know. Or maybe we could just have Nora never come back and you can just fill this spot because it's like you're always on your phone. So great. It's like, I mean, we could have a contest with our gavels, but that's cool because you're not even going to give a shit. Man, there's so many things to say. First of all, I'd like to say that the Make-A-Wish Foundation that we were giving a proclamation to made children get vaccinated before they could get their wish granted. How great is that? It's like, I mean, if you die before then, we don't really have to grant your wish, right? Oh, but if we really paid attention to the things that were going on, and that's why it's so hard, Helen, because it's like, you're real sweet. You're like a wolf in sheep's clothing, because it's like, I look at you, you pay attention. You're sweet if I come up and talk to you, but then at the end of the day, you'll go behind my back and be like, you know what, take her to jail. It's good, right? And you probably were like, go ahead and beat her up. Who knows? I'm not sure. But that's the sad thing, is that it'll be like, you know, people come and they look at you guys and they think that you're just doing what's so great, right? Because it's like on the surface, it looks good. It does. We got all this money and we're doing all these things. But when you look at the fruits of your labor, it's just really hard because it's corrupted. And as I said, like the whole county is falling apart. And you guys sit up here and you act like you're just so much more powerful. And Tara, I don't know what you're doing on your phone. Who knows? Who knows? But, you know, and you're not. And the people are supposed to have authority over you guys, like we say all the time. But you act like we're less than you. And unless we're in line with your agenda, we don't have a right to say what we do when we come in here, and we're like keeping people away. Well, when you've been beat up for coming in and speaking, I'm pretty sure I can say whatever I want at that point, and you would too.
Thank you. Next speaker, please.
I'm forfeiting my time. You guys aren't worth it.
Final call for Caitlin Radigan. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Hello, this is Kelly McCormick. I'm a public health educator with a focus on children, teens, and young adults. There's another new study adding to the abundance of evidence showing that marijuana use during pregnancy is linked to unhealthy birth outcomes. In a University of Utah study of 9,000 pregnancies across the country, almost 30% of mothers who use pot experienced adverse outcomes versus just over 17% of mothers who did not use marijuana. Higher levels of marijuana exposure throughout pregnancy were associated with higher risks. The negative outcomes included low birth weight, stillbirth, medically induced preterm birth, and blood pressure disorders. According to the report, the percentage of Americans using marijuana for medical reasons has more than doubled in the past decade, as state-level legalization has become more common. But many people remain unaware of the potential risks. The study authors say the research was driven in part by the contradictory answers that many people encounter when trying to learn about the health impacts of marijuana use, particularly for specific populations, such as pregnant people who might be especially at risk. Describing the study's findings, Dr. Robert Silver said, quote, "Cannabis use is not safe. It increases the risk of pregnancy complications," unquote. I urge the county to launch a public health campaign on this topic and to require marijuana retailers to provide warnings. Thank you.
Thank you. We'll now hear from the next caller.
Good afternoon, Board. My name is Kathleen Lippitt. I'd like to remind the Board today, as a public health practitioner, that the Board has that invaluable resource that was created by our own Dr. Ronit Lev, emergency physician, and College of Emergency Physicians, first medical officer of the White House. She has an extensive vita. She reminds that despite a record 2023 U.S. drug policy budget of $42.5 billion, our drug epidemic has not improved. We continue to have overdose deaths, and from July 2021 to 2022, 107,000 lost their lives. That is expected to rise to 112,000 in 2022. We have children being poisoned by high THC marijuana products. And what are the steps to reducing the addiction that you have to address with the providing homes and providing treatment? Is to protect the brain from all addictive substances, beginning in utero. Upstream, teach life skills, emotional resiliency, and primary prevention. Start in grade school and middle school to prevent the next generation from addiction. Don't allow the glamorization, normalization, and commercialization of dangerous drugs, as will happen with your marijuana framework for the future. Prohibit targeting and marketing drugs to children. Reestablish measured deterrence. Declare fentanyl a weapon of mass destruction to curb its supply. And stigmatize the use of addictive drugs, as done with tobacco.
Thank you. We'll now hear from the next caller.
This is Iron Worker Truth here, because long after the woodworkers rot, the iron will still be here. For proof, I went through my 2023 calendar, and it said I participated in about 154 meetings last year. I often had 2 meetings in one day. But am I going to do the same thing this year? I don't know. Maybe I'll just finally run for a political office. That's what some people want me to say, and others fear. I even heard some people today throwing out the challenge. Well, I don't fear criticism because I'm confident in my convictions, so I don't recommend that the Peanuts Gallery challenge me to run. Never say never, because that's what I said about commenting in person, and look what happened, including today. Hopefully my last year can serve as evidence that there are 0 excuses for every single person in this county to not be at least occasionally civically engaged. And I don't make resolutions because most of those are broken promises. And because of that, I suspect almost everyone in government has a resolution. But seriously, I have advice for every single person. That is more understanding from all sides. That all would judge each other not by their political beliefs, but by the content of their character, like Martin Luther King Jr. said. Because it's not just ethics and morals missing from our society. Empathy is also missing. And this last part of my speech is Michael Brando's fault.
Do you presume to criticize the great Oz? You ungrateful creatures think yourselves lucky. The great Oz has spoken. Pay no attention to that man behind the curtain.
I'm going to explain the movie Wizard of Oz. You sheeple out there are in need of a brain like the Scarecrow, heart like the Tin Man, and courage like the Lion. If you had these, you'd never be fooled or irresponsible. Dorothy, though an unlikely candidate for bravery, actually tried to possess these qualities and ended up challenging and revealing the inadequacies of the wizard, that he was no great and powerful man, who was just another person looking to rule over others via mystery and fear. So tap your shiny red shoes and you can win your way back home, too. You just gotta try. That's all.
Thank you. We'll now hear from the next caller.
Good evening, Board of Supervisors, and welcome, Chair Vargas. This is Ann Riddle speaking, and I wanted to share some really good news from on behalf of the public health world. Yesterday, the U.S. Supreme Court declined to hear R.J. Reynolds Tobacco Company's challenge to our voter-approved measure in California that banned flavored tobacco products here in California. You may remember that in 2020, we passed and the governor signed SB 793, this ban of flavored tobacco products. And its need was to make it illegal to sell and offer for sale or possess with the intent to sell all flavored tobacco products or tobacco products flavored enhancers. Unfortunately, the big bucks that's associated with big tobacco fought back and brought it to a proposition, in this case 31, in 2022. The people spoke, and again, we banned flavored tobacco products. What occurs to me is how potent is the type of money that big tobacco has. And my concern is that we see this type of money behind big marijuana. The capacity to be influential just because there's so much money to be made from addiction, tobacco, or marijuana in this case. And why is it important that flavored tobacco products were banned? It's because they are uniquely harmful. And this applies to flavored marijuana products as well. They're uniquely harmful because they mask the unappealing, harsh taste of tobacco or marijuana and can lure in new and often young leaders and get them hooked. This is predatory, unfortunate, and our county needs to have no part of it, be it tobacco or marijuana. Thank you.
Thank you. And Vice Chair Lawson-Remer, that concludes the request for non-agenda public communication this afternoon.
Okay, we now turn to adjournments in memory.
Yes, thank you, Vice Chair. I appreciate it. I'd like to adjourn this meeting in memory of Detective Raymond Charlie Wetzel. Charlie Wetzel passed away early December 2023 at the age of 58. He was dearly loved by all who knew him, and he was a devoted husband, father, son, grandfather, brother, and friend. He served in law enforcement as an officer with the Pacifica Police Department for 11 years, and then with the San Diego Police Department for 16 years until he retired. Charlie enjoyed riding his Harley, taking road trips, fishing, grilling, shooting pool, and smoking cigars with his family and friends. Charlie's fondest memories were coaching his son Robert in Little League and watching his other son Jonathan compete in Taekwondo. He cherished his time he spent with his grandsons. His life was marked by his love of the Lord. He brought Christ to others through his tender hugs, infectious smile, and contagious laugh. He will always be remembered for his humbled heart, selflessness, and generosity. Charlie was a beloved community man who truly enjoyed a blessed life. We send our sincere condolences to his entire family, Detective Raymond Charlie Wetzel. Thank you.
Thank you. We will be holding closed session tomorrow, so our meeting is adjourned. Yep, Claudia? Comments for closed session? Tomorrow, yeah. Thank you.
Thank you. The closed session matters listed on item 17 on today's regular agenda will be continued to tomorrow's session. The board will reconvene tomorrow, January 10th, 2024 at 9 a.m.
9 a.m.